Inspiración.
Inspiration. I think the word inspiration is the right one to describe what COVAX means in El Salvador and how important it is for our country. It has provided a middle-income country like ours the equitable access to make sure that everybody can work, that every single Salvadoran will have the opportunity to protect themselves and their lives from this disease. And I think it's extremely important to show the whole world how teamwork and how all those strategies that have gone forward to allow that equality and that accessibility will be very important. And for us, it's a historic achievement. El Salvador has made huge progress on a large scale, and these achievements where all of those WHO recommendations were safeguarded, where basic recommendations to delay the arrival of the disease as much as possible, to limit person-to-person transmissions and so forth. We have also improved our cold chain and cold storage capacities, and we can now store up to 16 million units to guarantee fair access to such an important strategy. And not only that, we have also rolled out more than 1,000 ICU beds that now give us a capacity to provide the support, that safety to the Salvadorian population. Those have been the fulfillment of these measures, and that has allowed us to become one of the countries that coped best with this pandemic. These recommendations culminated with the construction of the largest hospital in Latin America, and that is now setting standards in the field of this pandemic that protects Salvadorians, that gives them the peace of knowing that they can move on. We are now setting up that second achievement, not only the best and largest hospital in Latin America, but the best vaccination center. Thank you.
Excellencies, for your remarks and for joining us today. Now, with unprecedented speed, COVAX was set up and launched as a response to the COVID-19 pandemic to ensure equity in access to vaccines. And COVAX has proved it can work. But of course, challenges still need to be addressed for it to fully deliver on its goal of ending the acute phase of the pandemic. So let's hear what lessons we can draw from COVAX in a debate with representatives from Gavi, government, the private sector, vaccine manufacturers, and civil society. Now, this session will be moderated by financial journalist Bronwyn Nielsen. Bronwyn, over to you to kick off the COVAX one-year-on debate.
Thank you for joining us today to discuss COVAX 1 year on. We're going to look at the lessons that we can draw from the past, and we're certainly going to be looking at what we need to do differently into the future. It's my pleasure to welcome my panel of experts, Seth Berkley, the CEO of Gavi, Michael Froman, Vice Chairman and President of Strategic Growth at MasterCard, Paul Stoffels, the Chief Scientific Officer at Johnson & Johnson, Nguyen Thanh Long, Minister of Health in Vietnam, Dr. Endi Waziri, National Coordinator from the National Stop Transmission of Polio Program Network. Let's start, Seth, with you from a Gavi perspective and what you can draw from the past year of COVAX.
So hello, everyone. I'd first like to thank Prime Minister Suga for hosting today. This session is critically important because we know that the next pandemic is an evolutionary certainty, even if we don't know when it will happen or what it will look like. Let's remember how far we've come since June 2020. We've raised $7 billion for the Gavi COVAX AMC. We've secured deals for at least 1.3 billion doses for AMC countries from 8 manufacturers. We've distributed nearly 77 million doses across the globe on a historically unprecedented timeline. But we know we have a lot more to do. The central lesson from past year is that when everyone benefits when we consider ourselves as a single global community. More than 1.5 billion COVID-19 vaccine doses have been administered worldwide so far. Had they been equitably distributed, by now a significant portion of the global adult population would have had at least one dose. This may have prevented the tragic situations we're seeing in India and elsewhere, and would have helped us guard against the emergence of more contagious and more deadly new variants. One day this pandemic will be over. Now is the time to start the conversation about how the world can prepare for the next one. We need to share information and technology. We need to act together, and to act together early. The world will always need a mechanism like COVAX, a live network of partners keeping up their skills by delivering other routine and epidemic vaccines in peacetime, and yet kept idle from a pandemic point of view until needed, with immediate surge capacity and contingent financing. In parallel with our COVAX efforts, I invite the world to consider such a mechanism. We can't afford to wait, because the longer a pandemic endures, the greater the inequities and the deeper the global suffering. We've already come so far and learned so much. Generous support from donors has positioned COVAX as one of the largest global purchasers of COVID-19 vaccines. Timing is everything, however, and we need to ensure all countries are brought along early. Manufacturers are investing in new technology to scale up production, but clearly we need more geographic diversity on manufacturing and a way to ensure supply chains are resilient. This is critical also for ensuring a consistent supply of routine vaccines during a pandemic where competition for materials and manufacturing capacity is at its peak. But most importantly in this moment, Gavi, COVAX, AMC countries and economies are delivering vaccines, often in challenging and resource-constrained settings. That is where lives are saved. Thank you, and I look forward to our discussion together.
Michael, let's turn to you from a MasterCard perspective and give me a sense of why MasterCard has supported COVAX right from the beginning.
Well, thank you very much for having me. This pandemic has created one of the largest collective humanitarian responses in history, including companies stepping up around the world to support governments and international organizations in their efforts. But we're still very much at risk of driving a recovery that's not equitable. As some countries are coming out of the crisis, others lag far behind, and we need to continue to mobilize the resources and efforts to ensure vaccine equity and a path towards global inclusive growth. Over the last year, we've learned a lot about how to move at scale and at speed across both the public and the private sector to ensure an equitable and inclusive economic and health response. But stepping up doesn't just mean philanthropy, which is important, but also for the private sector to bring all of the assets that it has to the table: its technology, its products and services, its insights, its people. At our core, MasterCard, we're a trusted technology network. We've got capability in areas like data privacy and cybersecurity and digital identity and disbursements capabilities. We've helped more than 100 governments mount a response on both the economic and the healthcare side to this crisis. We partnered with the Global Fund and Rwanda to help the Ministry of Health at RISA to develop health data standards and a framework and guidelines. We made a $25 million contribution early on in the crisis in February of last year to help the Gates Foundation and Wellcome Trust set up the COVID-19 Therapeutics Accelerator. And that has leveraged now more than $300 million of donations from 17 donors. Our particular contribution has helped set up and roll out diagnostic instruments and antigen testing to 48 African Union member states. They'll ultimately allow 150 million COVID tests to be performed a year. And as you mentioned, we've made a $25 million pledge to Gavi, which with subsequent fundraising and the generous support from the Gavi Matching Fund now stands at $38 million. Those funds will support the core function of COVAX in providing vaccines, but it will also support the deployment of digital tools that will help the rollout and the delivery of those vaccines. We know that the challenges of vaccination don't end when the vaccines arrive. Before the pandemic took hold, we were working with Gavi on a digital platform, the Wellness Pass, which digitizes vaccination records and helps give greater insights to health service providers. And now we've been able to apply that to COVID-19 vaccine deployment in the most marginalized offline communities. This type of innovation can help individuals secure their records, and it helps health workers and governments monitor demand and ensure that people are contacted for follow-up vaccines and treatments. We're focused on bringing this technology to the base of the pyramid across Africa and in other developing countries, and we're working with Gavi across a wide range of countries, from Mauritania to Ethiopia, to provide our technology to strengthen their digital health platforms. Why do we do this, you ask? It's not because we're a healthcare company, we're not. But our view is that inclusion is core to our business model, and that we thrive when economies thrive, and our business is healthier when more people are also enjoying good health. We encourage other companies to do what they can in their own respective areas, and we encourage governments to explore the full potential that the private sector can provide through partnership in helping increase the efficiencies and effectiveness of their efforts. Because for this to be a collective response, we all have a chance of doing what we can to build an inclusive, sustainable digital economy, and we're delighted to be part of it. So thank you again for having us.
Paul, let's turn to you as J&J, the manufacturer of a vaccine. Now, you have been supplying a vaccine that protects people against COVID. You're now also supplying into COVAX, and you are transferring technology across the world in order to help with the supply of vaccines. Let's talk a bit about your experience over the last 12 months.
I'll first look at your partners, and including many of the governments represented here today. The global scientific, medical, regulatory community has broken all historical records in vaccines R&D. And we made this happen because we invested over the years already significant, over 2 decades, into scientific knowledge and technology platforms. And this was not only important to be able to transfer technology to developing world countries, but also the experience we developed with Ebola, Zika, HIV, and also RSV learned us how to make, how to produce, how to upscale, and that helped us to be ready to produce COVID and to develop a COVID vaccine very quickly after the genetic code became available, but also to be able technology. Not unimportant, the work in Ebola has helped us to learn all of that, upscaling and making sure that we could distribute. In addition, we learned on how to transfer that technology working together with different companies. And I'll come back to that in a minute. But we recognized that to be able to make this vaccine available, we had to do a massive effort to transfer it. And as you have seen last year in September, we made the first commitment to 500 million vaccine doses to COVAX. In addition to making doses available, of course, the development of the vaccine was important. So we developed the vaccine in 3 countries. We worked on a single dose injection and a single dose which is compatible with normal use at 2 to 8 Celsius for normal distribution. And that helped us to be able to make a vaccine at large scale and make it available in very similar circumstances. We started working on manufacturing sites already in March last year. By now, we have 11 manufacturing sites ongoing where we are upscaling at the moment, where we are implementing, validating. And these include 2 sites in South Africa and 1 in India. And that was focused on increased supply and security of supply worldwide, also boost the manufacturing capacity in the developing world. In Aspen, an early collaboration with Aspen in South Africa is an important example of how this worked. Aspen had significant available capacity in fill and finish, and they had a strong quality track record of making vaccines in South Africa, as well as a highly qualified workforce. And the high and experienced workforce is critical for tech transfer at recipient company side, especially in such a short time frame. A vaccine does not tolerate, and therefore the needed to be equipped to work with disposables, recipients, and tubing. And today, less than 12 months later, Aspen is producing millions of vaccines on a weekly basis. But the critical criteria are technological capabilities, very well-trained workforce, and the willingness, of course, of the partners. And now this vaccine plant is a critical partner in the supply to, but also for the African Union and for other parts of the world. In addition, we transfer technology to BioE, and that's another example, but even more complex. There, we are transferring both the technology to make vaccines, which is called drug substance, as well as performing fill and finish, called drug product, to BioE. For the fill and finish, we're ready to use vaccine fill and finish plants, but also again, we needed to turn it over to disposables. Tech transfer and validation is happening as we speak. First vaccines will be produced and delivered over the course of the summer before September. For drug substance, early on, already a year ago, immediately we all the equipment needed for doing the bioreactors and downstreams, and equipment to allow manufacturing for up to 1 billion doses once this all in function. We ordered that, we trained the employees from BioE, we sent them to our plants in the Netherlands and in Switzerland to be trained in the specific technology, but also into very special technology which was needed for the disposables. Today, vice versa, the J&J teams are in Hyderabad to assist with the installation and validation. And this vaccine plant with the 1 billion capacity should be ready before the year end. Again, the same requirements and the same conditions were available. Very highly experienced workforce, excellent quality track record, openness to collaborate, and capable of implementing a tech transfer. And that's very important. For tech transfer, you need a partner which can be the recipient of highly technical type of manufacturing and implementation. And all of this hopefully now will lead to being able to supply up to 1 billion vaccines from those plants to COVAX. At the moment, we have a deal with 200 million by year. We have 300 million in discussion for 22, combined up to 500. Today, we also have to the African Union commitment of 400 million doses, and then certain other lower and middle income countries have complement that for 1 billion doses in the next 12 to 18 months. So of which Gavi COVAX will be the large majority, and hopefully also a big implementation partner for many other vaccines across the world. So overall, hard work, early start based on known technology and capability of our partners to be able to receive the technology in such a short time frame. We talk here about 12 to 18 months. This has been never done. Normally you do this in 3 to 4 months, but thanks to the huge and exceptional commitment of both of governments to work with the regulatory authorities, but also the technical partners in the countries, we will be able to get this going over the very short time. Back to you.
Let's go now to the Minister of Health in Vietnam, Minister Nguyen Thanh Long. Minister, you have overseen the pandemic, the response to the pandemic in Vietnam, as well as the supply of vaccines through COVAX. How's the rollout going? And when can we expect production of vaccines in Vietnam?
Thank you very much. Good afternoon, ladies and gentlemen. First of all, on behalf of the government of Vietnam, the Ministry of Health highly appreciates the program of Gavi and World Health Organization in creating the COVAX facility with the role providing 2 billion doses of vaccine worldwide in 2021, ensuring fair and equitable access to COVID-19 vaccine for every country in the world. It is an opportunity for all low-income countries to have access to COVID-19 vaccine. Vietnam highly appreciates the Japanese government and the Gavi in organizing the important summit. Vietnam has now received nearly 2.6 million doses of the COVID-19 vaccine from the COVAX facility. Out of the total, nearly 40 million doses of vaccine committed to be supplied for Vietnam in 2021. Vietnam has quickly implemented vaccination for frontline forces to contain the epidemic and ensure the safe and effective vaccination campaign according to the COVAX vaccine rollout plan. Currently, Vietnam is facing new COVID-19 community our liquidity is more complicated than the previous outbreak, as recently identified variant of concern has been reported in some area. The number of cases recorded in high in manufacture and in the community. So it is essential to speed up the vaccination campaign. Therefore, we hope that COVAX facility would help us to continuously improve the access to COVID-19 vaccine. We have been proactive in buying technology and receiving technology transfer to secure the sufficient vaccine for the need of our people. We fully commit with the COVAX and WHO our participation in technology transfer hub for the COVID-19 vaccine production. We wish to set up and will invest in a vaccine production factory in Vietnam. Vietnam look forward to being franchise vaccine production to supply for COVAX, other countries and Vietnam. On this occasion, on behalf of the government of Vietnam, the Minister of Health would like to inform that Vietnam will contribute $500,000 to the COVAX facility program. This support shows our appreciation for the effectiveness of the program in responding to the COVID-19 pandemic and affirm the commitment of the government of Vietnam to continue the strong participation in COVAX facility. Finally, on behalf of the government of Vietnam, I would like to express our sincere thanks to COVAX facility, international organization, and countries around the world for supporting Vietnam in accessing COVAX facility, vaccine, and other vaccine sources. We hope that with the dignity and cooperation of the program community through the COVAX facility, we will ensure the achievement of the set target to contribute to the fight against the global pandemic. Thank you very much.
Minister, that's great news about your pledge to the advanced market commitment. Remember, you heard it here first. Now let's move to Nigeria and speak to Dr. Endi Waziri, who's handling the rollout of vaccines in Nigeria. Dr. Waziri, how is the rollout going in your country?
So good afternoon. Polio eradication in Nigeria has taught us a lot of lessons, and we've used the structure for control and prevention of many diseases. We used the polio structure when we had the Ebola outbreak in 2014, and basically looking at how the incident management system operates within the Emergency Operations Center. So when we had our first case of the COVID-19 in Nigeria, we set up the same structure using the incident management system. And when we also received the first batch of our vaccines, we still use the same system to roll out the vaccines. So first of all, setting up different work groups within the operations center, having like a technical working group, an advocacy working group, a strategy working group with different functions and TORs to support the rollout of the vaccine in country. And then one very important thing that we use during the polio eradication in Nigeria is the use of our community structures, looking at religious leaders, looking at traditional leaders. These are people that within the African setting are listened to, they are respected, their voices are heard. So we use those same structures to ensure that we could reach down to the communities to gain acceptance for the vaccine and also reduce a lot of issues around vaccine hesitancy and create demand generation. We also ensure that in one other lesson is the use of strategic leaders during vaccination campaigns. So when we had issues with non-compliance and hesitancy around polio vaccination, we got the president to openly vaccinate his granddaughter. So during the COVID vaccination rollout, what we did was to ensure that strategic leaders, very key traditional leaders and religious leaders received their jab of the vaccine openly so that people see and they know that, oh, this is actually the vaccine people are taking and nothing is happening to them. Because prior to that, there was so much hesitancy and rumor around the vaccine. The vaccine has a lot of things. It's not a real jab and all that. So we needed to douse all those impressions that have been created within the community. So using that structure, really, really worked for us. And then having a platform where we could report our data real time so that we could take decisions immediately was also a great strength that we had learned from the polio eradication program. So we created an electronic management system for capturing our data, whereby people are able to schedule their vaccination, get a timing, and then go for their vaccination, but also get a QR code for authentication so that people actually get the jab, and you can verify that each person got the jab during the rollout. So those are key lessons that we learned: use of community structures, use of our traditional leaders, having data available for informed decision, ensuring that our strategic leaders are vaccinated openly, ensuring that religious leaders are also vaccinated openly, but also training and retraining of our vaccination teams to be able to speak to clients appropriately, but also guide clients on the vaccine. Because sometimes when people get to the vaccination site, they're even hesitant to take it because they think there are going to be some side effects. So really training and retraining our vaccination team to be able to educate the clients appropriately also helped us in the rollout of the vaccine here in Nigeria.
Thank you, Dr. Waziri. Fascinating insights from the Nigerian perspective. Now let's talk about the future. Seth, knowing what you know now, if you could go back in time, what would you have done differently?
So thanks for the question. Before I jump into the question, I thought the discussion from the rest of the panel was great. It shows the power of all the different sectors in working on this. But I particularly want to call out that very generous contribution from Vietnam and appreciate that this shows the power that a country like Vietnam receiving doses feels to supporting this global effort. So thank you very much, Vietnam. In terms of how we think about this, I think what's important is we have to make sure that we have the ability to jump quickly into this. And one of the advantages that Gavi had before is, of course, we are a network. And so given that we were a network, we could bring together the WHO and UNICEF and the World Bank and the Gates Foundation, industry, both from developed and developing countries, civil society, the private sector. And that meant we could have kind of a whole response where people had already had skills working together. The one group we had to bring in was CEPI, the Coalition for Epidemic Preparedness Innovations, because they were doing R&D. But of course, we were working with them on other epidemic vaccines. So this meant that we could jump in and move it quickly. But what are some of the biggest lessons for me? Well, first of all, we really need to have contingent financing. We had to raise a lot of financing to be able to put orders in. If we could have done that right at the beginning, that might have helped with supply. We also should have had more surge capacity to be able to work with countries. We know a lot about the immunization systems in countries, for example, their cold chain, because we've worked over the last 5 years to strengthen it. But there was an opportunity here to go in quickly and try to build that up. And all of this requires work from people. And lastly, I'd say, we jumped right in knowing that much of the initial manufacturing capacity was going to be used for high-income countries. We worked very quickly to try to work with developing country manufacturers. Of course, later on, when the surge occurred in India, this meant that that capacity was very helpful in India, but wasn't able to supply outside. So that's why we really need to be thinking about having a more diversified manufacturing base going forward. Lots of lessons. We need to capture them, and we need to make sure that we can use them when the next pandemic occurs.
Let's go back to the manufacturer's perspective. Paul, I'm going to get you to weigh in on what we need to do to prepare for a potential future pandemic.
Well, I think we got a big warning this time from COVID was a big warning for the world on not to underestimate viruses. We have been very lucky over time that Ebola didn't come and made a big pandemic. Zika, SARS-CoV-1, MERS, but HIV did. And so we learned over the years that viruses could become pandemics. And I think we were far too comfortable not to prepare. I think with Ebola, CEPI emerged, and that was a very strong initiative to prepare at least the science, the research and development of different viruses. So 20 viruses were identified as key pathogens which could be very dangerous for the world. Now, that didn't go together yet with developing a large production capacity all over the world to be able to produce 5 to 7 to 10 billion vaccines. I think now we are in a much better state, but we should not get complacent. Yeah, we could have done maybe more sooner last year by, first of all, diagnosing faster, putting measures in place to put more controls so that people, for the infection, I think we did a record development of less than 12 months for all of the vaccines and try to maximize manufacturing. But transfer of technology takes time. Plants were not available in the world to do this too. So now we are much better equipped, but we should not become compliant. We should make sure that this capacity we have built in research development, the framework, COVAX, Gavi in the world, as well as in the manufacturing plants, that this now stays ready and stand by for the future to go much faster. And from getting it done in 12 to 18 months, we should get back to 12 months, maybe to 6, and maybe to a very impressive number, which we try to put forward in 30 days. 100 days, but it is learning from the past and not forgetting the past for building the future capacity to prevent once and forever that this is going to happen a second time to the world and put the world on hold for almost 2 years now. Yeah.
Dr. Waziri, you've dealt with polio in Nigeria, Ebola. How did those experiences help you with the rollout of COVID vaccines?
One lesson that we have learned is that every country needs to have a resilient health system with good laboratory capacity for early diagnosis and prompt turnaround time for lab results. So that really helped us. Initially, at the beginning of the pandemic, we were short of labs, but we were able to quickly roll out testing labs across the country. So this is something that will stay post the pandemic, having adequate laboratory capacity with human resource to be able to test different types of microbes and bring out results in good time. For the vaccine rollout, so institutionalizing rollout of vaccine is very, very important. So using existing structures so that they could be strengthened rather than creating parallel structures. So with Nigeria, we rolled on the same structures that we have used to roll out childhood vaccination. And I think that is one big lesson. So rather than rolling out parallel structures, building on those structures, strengthening them, ensuring that vaccine rollout to whichever community and whichever population is institutionalized in country within the existing structure is very important for sustainability. And these same systems can be used to improve other primary healthcare services beyond immunization, beyond childhood vaccination, but also to improve access to other healthcare services, especially the primary healthcare services.
Dr. Waziri, a follow-up question. Vaccine hesitancy is a big challenge and slowing down your efforts on the ground. How are you dealing with this issue in Nigeria?
So looking at lessons learned from polio eradication, we had a lot of hesitancy over a very long period of time. At some point, vaccination actually stopped or was paused in some part of the country. But when we engage the traditional and the religious leaders, like I said earlier, these structures are highly, highly respected within the communities. So we engaged them in polio eradication and we started recording some successes and we started moving forward. And last year, in August last year, we were actually certified polio-free. So riding on those same structures, that using them for advocacy, using them for communication, early community sensitization, not waiting until we have a vaccine, but even while the vaccine is in the process of production, there's early media engagement, continued enlightenment of the population, so that they are aware of the things that are, of the vaccines that are being produced and how they are being produced, to dispel a lot of rumors that will come up. So being ahead of the rumor, of the rumor mongers, being ahead of those that generate the rumors, and ensuring that there's a lot of community engagement, community sensitization, and media engagement is very, very important for vaccine acceptability.
If and when we have another pandemic, Michael, what role should the private sector play?
Well, I think there's been quite an evolution over the last few years in the private sector in terms of companies being more interested and willing to engage in social impact, economic impact beyond their narrow short-term financial interests. Some of that's driven by the ESG movement, some by the pandemic, some by other developments, including in the United States around racial equity. So there's a great willingness there now. And I think now the challenge is to take advantage of that and make it as easy as possible for the private sector to become a partner of governments and international organizations and NGOs in this area. And Gavi has been a terrific partner to the private sector, really knows how to do it well. And I think there are a lot of lessons to be learned there for future pandemics, but also for other international organizations who want to leverage the assets of the private sector. And the second piece I would mention specifically is there's been a lot of advancement in the private sector in recent years around the whole issue of data science and data analytics. And bringing those advancements from the private sector to the public and the civic sector can have tremendous benefit, including being able to identify through surveillance the potential for pandemics very, very early on before they spread from one country to another, and be able to feed the process that Dr. Stuffles mentioned in terms of getting early development of vaccines. So leveraging the private sector, and particularly the new tools and advances they've made in the areas of data science for social impact, I think could be very positive.
Seth, let's talk about the future.
I have to say that it is a challenge, because normally what happens is during active epidemics, people really weigh in and work very hard at it. But then during so-called peacetime, they get distracted and move to other areas. I remember Paul mentioned about Ebola when this was the story of the decade, and the engagement was there. And then afterwards, it was very hard to raise finance to go ahead and purchase Ebola vaccines. So I think it may be different this time, given the magnitude of this pandemic, but this is a critical priority for the globe, is to have everybody focused. But the other thing that I think is really different, we talked a little bit about hesitancy here, is this is the first time you've got a global pandemic in the era of social networks. And we ended up with misinformation spreading from one political leader to one country to another area, having effects very distant from where the rumor started. And so how do we create a system to make sure we get the right information, that we block misinformation, we take advantage of the tools that that Michael talked about, that can allow us to be able to track very carefully. You heard in Nigeria, even looking for fake vaccines, trying to make sure that they can, follow them. I think these are the types of preparations we have to do, because as I said, it's evolutionarily certain. There are going to be more outbreaks. We can do better, and we must do better.
We've heard about some of the challenges that COVAX has experienced over the last 12 months. But I'm also hugely encouraged by the solutions that have been presented. We've heard about how technology transfer is happening in an attempt to increase supply of vaccines globally. We've heard how countries are overcoming the pandemic, and further, how they are proactively rolling out the vaccines. Here's hoping that the pledge from Vietnam bodes well for the rest of the summit.
Thank you all for sharing your reflections on the lessons drawn from COVAX in that very engaging debate. And thank you in particular to Vietnam, which has become an AMC donor for the very first time. Now, as the COVAX AMC looks to close its immediate funding needs, which is to achieve almost 30% coverage by securing doses through the AMC, we must also urgently ask ourselves what innovative options may be deployed to create stable, sustainable markets in 2022 and indeed beyond. Well, joining us now to share his economist perspective, we have Dr. Werner Hoyer, President of the European Investment Bank, and COVAX represents the EIB's largest ever global public health investment. I'm handing over to financial journalist Bronwyn Nielsen, who is with Dr. Hoyer.
With me now is Dr. Werner Hoyer. He is president of the European Investment Bank. Dr. Hoyer, thank you so much. It's great to have the opportunity to speak to you in this forum, especially as the European Investment Bank has been a key partner to COVAX. And we're looking to get your thoughts, sir, on how the EIB can help economies to end the pandemic, further to unlock economic output, and then, of course, also to look at how, as a multilateral system, we can look to preparing ourselves for potentially the next one. So let's initially start with the fact that you have been obviously in the development finance arena and also in the European domestic finance space for many, many years. And I suppose the key question, sir, is whether you have ever seen such a convergence of economic interests as we are seeing now around access to vaccines.
Well, thank you very much for this very interesting question. It's amazing indeed how things are moving together and how good it is that multilateralism is back. Because if we would stay silent on this issue and be negative or hesitant on multilateralism, I think we would not have the opportunity to grab the situation now and say, okay, with what we have learned domestically, regionally, nationally, we can now move globally and achieve something that necessarily can only be done on the global scale. Because nobody in the United States of America, in Japan, or in Europe will ever be safe if people in the poorest countries of the world will not be safe as well. And this is one of the key issues that the pandemic has taught us.
Dr. Hoyer, we've seen so much sadness over the last 12 months. Of course, death. We've seen health workers stretched to their limits. We've seen incredible economic stress across the world. And yet, at the same time, we've seen scientific innovation. We have seen the licensing of vaccines, the deployment of vaccines. And I suppose the key point here is to understand what drives an institution like the European Investment Bank, the institution that you lead.
Well, of course, the EIB is the EU bank, the bank that is set up in order to support the political objectives of the European Union. And these political objectives have a domestic character and they have a global character. And we have a holistic view at seeing it together. And this is very evident when it comes to the issue of vaccines and to the issue of COVAX. I mean, we have been, since we are a very innovation-oriented institution, been very, very active in the research and development or the financing of research and development on vaccines. And sometimes you are simply lucky. I mean, we had in our portfolio a company that has been working with a new technology on medication against cancer. And this technology is called mRNA, and this is the technology that is promoted by BioNTech and Pfizer. They're our clients for a long time. And therefore, when COVID came last year, we were immediately on the spot in order to support, but not only BioNTech, but other companies as well. And that is something that we need to share now. We have had a summit in Paris, invited by President Emmanuel Macron, where it was very, very impressive when the African leaders told us in very clear terms what they expect from us, and that is sharing.
Dr. Hoyer, in 2012, you called for a new Marshall Plan to invigorate the Greek economy. And I suppose a very similar motivation lies behind COVAX advance market commitment. and that is really that we need to reinvigorate the global economy. So what lessons have we learned this far, and how can we accelerate the progress?
Well, 8-9 years when we were in a critical financial situation in the European Union, we observed huge liquidity available and very, very many very, very good projects, but the liquidity doesn't flow into these projects. So what we thought was there must be a reason for this hesitance or the hesitation to go into these projects. So obviously it was necessary to do something on the risk front. And what we did at that time was to convince the European Parliament to say, okay, if among these many, many projects that we want to support, one or the other might go wrong and there might be a loss, can't we agree that the very small first loss piece is being financed out of the EU budget? And with that relatively small guarantee, that at the beginning was only 16 billion euros, we managed to unlock overall additional investment of more than 500 billion euros. So this is something that we must have in our mind now as well. We must get some substitute for patient capital coming from the markets and invest into things that are for the time being risky, so risky that the private sector alone cannot do it, but where we provide the start capital and then the private sector can come in. I'm absolutely sure that on the issue of vaccines, it can work and it will work. And beyond that, we go into medication and it will work as well. And then we have to make sure that we go into other spheres of health deficits, which we have in this world as well, because we must clearly see that this has not been the last pandemic. And there will be huge increases in crises over health issues that we need to learn from out of the present crisis.
Do you believe that the commitment is coming quickly enough towards attaining that patient capital that you refer to?
No, it's certainly not enough. But I must say, as the Bank of the EU, we have been active in support of COVAX with 600 million euros. We are ready to increase this by a reorientation of another 300 million euros. So this is already, so to speak, safe for COVAX. And in addition to that, we are active with 250 million for countries for vaccine purchases. And we are also active in the setting up of production sites in different parts of the world in order to boost the production of vaccines on the ground and not only rely upon exports from Europe to these countries, which, by the way, is already quite an achievement because the Europeans are sharing, and 50% of all vaccines produced here go into the developing world. But a lot more needs to be done because otherwise we will be hit back. It's in our own interest to make sure that not one day we are surprised that mutants come from other parts of the world, and then the whole cycle will begin again.
I think that's a very important point, and you referred to it earlier in terms of how we as a multilateral system can prepare for the next one, you know, be it a variant, be it a mutant of the current coronavirus or current COVID-19 pandemic. Do you think that given the panic that we have seen, that the relative authorities are looking to preparation and working ahead to safeguard against that future potential pandemic?
Well, I think we have to be self-critical that we are discussing questions of a potential pandemic now for more than a decade. I remember a simulation game I participated in the United States in 2006. And if I ask myself, looking back nowadays, what have we learned from these simulation games at that time, where all the issues from closing of the borders to triage and all these things were already on the table? Have we learned something? No, we have not. We went into this pandemic unprepared, and this must change. We must be prepared for the next health challenge, and with microbial resistances and other issues, it is necessary to be better prepared.
Dr. Hoyer, sitting in a developing market myself here in South Africa and representing the African continent, there is a sense of panic afoot that we perhaps will see a greater chasm between emerging markets and the developed world if we don't achieve that equitable access to vaccines. Is that a very real fear, or do you believe that we are getting on top of the situation at this current juncture?
Well, I'm a structural optimist, and I believe at the end of the day we get this under control. But we have to work with more ambition on this. And I've listened attentively to the African leaders the other day in Paris, and that was extremely impressive. And what we are doing there is not only in the interest of the people in the least developed countries, it's in our all interest. It's the question of the survival of humanity. And therefore, there is no reason not to be a fair sharer and to contribute to the solution of a problem that we have right now, but with others have as well, and we have the better opportunities to get on top of it. So we must see this as a global challenge that can be met only globally.
Dr. Hoyer, you've referenced hearing from multiple African leaders recently. What was the key request? What was the key messaging that you heard from the collective?
Well, I must say all the requests I heard were very, very reasonable. It was nothing that was that was beyond the imaginable. The key thing is share, and we must say we Europeans have shared, other parts of the world have not been so active in sharing, or could not anymore, because all of a sudden India was in a very, very difficult situation, and we have to acknowledge that. The second thing is, let us help to set up production facilities in order to allow several African countries, for instance, to come up with their own production. That is relatively easy, if I say so, in South Africa. That is easy with the Institut Pasteur in Senegal and other places. But I think this is a message that must be spread. And it is not an easy thing to do. Some people believe that you just pour a couple of liquids together and then you have a vaccine. No, this is an extremely complex and complicated issue. But if there is a will, then there is also a way.
Another pertinent question here is how you look at the balance between deploying grants or giving access to grants and required domestic resources. Could you give me a little clarity on how you see that equation?
Well, of course, for us as a bank, the situation is crystal clear. We are ready to contribute with loans, and they're pretty big loans. And we cooperate very closely with the EU institutions as part of Team Europe, and therefore we can also blend our loans with the grant money that comes from the European Union. So that works quite well. But of course, you can also raise funds locally, and that all has to go together. So it is not in one way or the other. It's always a question of ability to cooperate and bring your funds and ideas together.
Dr. Hoyer, you mentioned that you are the eternal optimist. Let me put this to you as a final question. How long do you think it's going to take us to achieve equitable access to vaccines across the world?
My gut feeling is that it is going to go now very fast. We have had several difficulties to overcome in Europe, in the United States, and other parts of the world as well. But now the ball is rolling, and I don't see why we shouldn't get it rolling more quickly in Africa and in those parts of the world where the setting up of their own production facilities is the most difficult challenge. But I think finally we see light at the end of the tunnel, and it's not the other train coming to us.
Dr. Werner Hoyer, thank you so much for your time, sir. It's been an absolute pleasure. Dr. Werner Hoyer is president of the European Investment Bank.
Thank you so much. All the best to you.
Thank you, Dr. Hoyer, for sharing these valuable insights. The EIB's support is critical to the success of COVAX. We'll now hear from Anuradha Gupta, Gavi's Deputy CEO, on the importance of strengthening community engagement to build trust, confidence, and active demand for routine immunization. Anuradha, thank you so much for joining us today. So I'd like to begin our conversation by actually looking back at the early months of the pandemic. The focus was, on developing the vaccine and on the massive effort to get them out to countries. And we know that whilst most people right now can't wait to receive the vaccine, we're also hearing concerns of some places where there's low uptake. What are these concerns and how worried should we be about them?
Thanks, Edith. As you rightly point out, public trust is vital to fully harness the power of vaccines. Vaccine equity begins with fair and equitable distribution of vaccines, but is truly accomplished only when all people, regardless of their circumstances, come forward to receive these vaccines with an earnest belief that they are safe and effective. That said, many supply-side barriers can also contribute to low uptake. For example, the vaccine might not be offered at a convenient time or place, or there might be information asymmetry about eligibility or how to register for vaccination. Also, COVID-19 vaccines are currently extremely scarce and therefore cannot be opened up to all adults at the same time. Therefore, countries are having to undertake vaccinations in a phased manner, beginning with high-risk groups such as health workers and the elderly. But low uptake in these prioritized groups, while other non-priority populations are scrambling for access, means we are seeing in many places a rather paradoxical phenomenon of simultaneously under-demand and over-demand.
Well, speaking about this paradox, at the beginning of 2019, even before the pandemic, WHO declared vaccine hesitancy to be one of the top 10 risks to global public health. Anuradha, why has it become such a problem and how has the pandemic impacted this?
We must not forget that most people around the world are very positive about vaccines, and vaccination has become an accepted social norm. Each year, we manage to reach almost 9 out of 10 children around the world with key life-saving vaccines. That is an incredible achievement. In fact, immunization is one of the most impactful health interventions in history. But reaching 9 out of 10 is simply not good enough. We want to make sure no one is left behind with immunization. The heartbreaking fact is that it is often the children most in need in urban slums, fragile, conflict settings who are left behind. Even before the pandemic, nearly 20 million children born every year remain deprived of the most basic course of vaccines, with 2/3 not even receiving a single shot. These are our most unfortunate zero-dose kids. And this is for a range of reasons, including lack of information or disinformation, or diminished trust in institutions, besides, of course, many, many weaknesses within health systems. Trust does play a big role in immunization. We have seen considerably lower child vaccination rates in areas where local population displays high level of mistrust towards local authorities. Unfortunately, this pandemic has seen rumors and misinformation around health and immunization spread at unprecedented speed and intensity across all regions and in all languages. The level of fear and anxiety caused by COVID-19 has created an environment where it is very difficult for people to know what information to trust. So it is very important to dispel public fears and doubts with good information, timely communication. But we are also reminded that making services available to people does not necessarily mean they will go to them. To build trust, we need to understand communities and their needs much better. Only then they would demand essential health services such as vaccines as their basic right.
Right, and so you're talking about the importance of trust and community engagement. I'd like to shift the focus back to us. What can we do to build trust within communities?
One of the understand how people think, feel, and act in relation to vaccination, can we really design effective approaches? I feel we need to learn from previous experiences. For example, we saw this with polio eradication in India, where in spite of our massive effort, polio remains stubbornly persistent in marginalized communities. It took a different approach of mobilizing a new cadre of women from local communities to successfully reach these families. And these community mobilizers took the time to listen and understand concerns and wider needs of these families. And this was really key to winning their trust. We are starting to hear about similar efforts for COVID-19 vaccination. For example, in a Muslim community in Western Nepal, religious leaders have been helping health teams and officials to counter COVID-19 vaccine misinformation and hesitancy. Similar efforts are going on with traditional leaders in Ghana. For example, the king of the Ashanti Kingdom, his wife, and several chiefs have helped to increase vaccine confidence in their region. In Indonesia, UNICEF have been using rather innovative approaches of hoax busting on social media. The pandemic has shown a new spotlight on the imperative to think differently and build a true social movement for vaccines. And I really think we owe it to the most vulnerable, marginalized, and often forgotten populations to understand their needs and make sure we rise to the occasion to listen to them and give them the information they need.
Wow, I couldn't think of a better place to end this interview. 9 out of 10 is not enough. Anuradha Gupta, Gavi's Deputy CEO, thank you for sharing these powerful insights.
Thank you.
This pandemic is an opportunity for us to think about demand differently and to adopt approaches that we haven't taken in the past. We'll now hear a number of statements of support, but first, it's with immense pleasure that I welcome Mrs. Grata Machel, international advocate for women's and children's rights and one of Gavi's first leaders. Mrs. Machel, thank you for joining us on such an important day. The floor is yours.
I am always inspired by the progress made by the Gavi family. It has come a long way since I was a board chair following Madiba almost 2 decades ago. I was not surprised that Gavi reacted so quickly when the COVID-19 pandemic hit, because it has done this before for other vaccine-preventable diseases. At the start of the pandemic, I was inspired to see leaders from across the world work together to fight a virus that knows no borders. As our human family was equally threatened, the scientific family responded as one in record time to develop COVID-19 vaccines, diagnostics, and treatments. Yet, as soon as vaccines trials started to show positive results, we began to see this unity crumble, and the inequalities in access to COVID-19 vaccines between countries become horribly visible. Today, the vast majority of vaccine supply is concentrated in high-income countries as political leaders in these countries looked out for their own, unfortunately, leaving much of the world still unvaccinated and vulnerable. Because of this virus, lockdown measures, the economic downturn, the vulnerable and disadvantaged are worse off now than before the pandemic. Does this not alarm anyone? I fail to understand how we went from complete solidarity as a human family to some countries hoarding vaccines many times over than what they need to vaccinate their populations. As one of the human rights activists, I'm calling for universal and affordable access to COVID-19 vaccines so that no one is left behind without a COVID-19 vaccine, but also diagnostics and treatments while the vaccines become available. To make this a reality, funding of Act A and COVAX is needed. Doses have to be shared in a magnitude of at least 1 billion by the end of 2021, and delivery systems must be ready. Health systems have to be strengthened and the trust must be rebuilt, including reinforcing vaccine confidence so everyone is ready to take the vaccine and bring the pandemic under control. A whole of society approach will be key to building trust and reinforce the value of immunization and other essential public health interventions. It is why today I thank the government of Japan and the Gavi family for inviting me to call again on our shared humanity and our world leaders to support Act A and COVAX in its mission to leave no one behind. We can only overcome this global challenge together. I thank you.
As we bring in the new COVID-19 vaccines, we are understanding the importance of demand and community engagement all the more. I learned this from almost 3 decades of working on polio and other childhood immunizations here in India. In areas with good services, parents trust the system and there is usually no vaccine hesitancy. However, in neglected areas, hesitancy could even turn into very strong resistance. This speaks to the critical role of the frontline health workers, the quality of care they provide, and the need for them to treat caregivers as clients. To gain trust, communities must also be considered as partners. Their understanding of how vaccines protect must be built up through good, clear, two-way communication. For some people, the COVID-19 vaccine is the first adult vaccine they are being asked to take. And here in India, there is a great deal of fear around the disease. For example, migrant workers returning from the cities may not be allowed back in their homes in the villages. And unless they understand why, they may find it difficult to trust someone asking them to take this vaccine. So it becomes critical for us to communicate before rumors and misinformation reaches them. The COVAX initiative is playing a vital role in making sure that COVID vaccines reach everyone, everywhere with equity. After all, no country is safe until everyone is protected. Thank you.
We Civil Society Voices would like to say thanks to COVAX facility. The global community has defined the global risk-sharing mechanism aiming at assuring fair and equitable access of COVID-19 vaccines to the nation with low affordability. We civil society organizations garner trust with communities who may be reticent to accept COVID-19 vaccinations and help to ensure that accurate information prevails over misinformation on vaccination. We are also familiar with and operate in vulnerable communities who may be overlooked or neglected as a part of national vaccination rollouts and will help to ensure that these communities are included in vaccination plans. As an example, in Pakistan, CSOs are helping government in reaching out to the communities which are invisible in their plans, and it is spreading positive messages on COVID-19 vaccines through a range of interactive tools such as for and against debates, role model and youth champions. In Cote d'Ivoire and other African countries, grassroots organizations and networks have set up citizen-led surveillance system to ensure maintenance of essential services, including vaccination, provision of PPE to health workers, and advocate to alert authorities. These multi-sectorial initiatives are led by youth, vulnerable communities, women groups, and religious leaders. Civil society is thrilled and committed to engage with diverse stakeholders globally to ensure all the voices are heard in governance, decision-making structures, and we ensure stakeholder consensus in all interaction. The world is still not secure from the threat of virus, and emerging risk is evident across nations. Developing world where only 2% of planned COVID-19 vaccine doses are able to reach, vaccine hesitancy is an emerging barrier. If we want to beat this pandemic and save lives, solidarity with everyone, everywhere must prevail. Thank you, and together, let's build back better.
Half a year into the COVID-19 vaccination campaigns, we today face a situation that reflects some of our worst concerns. At a point when 20 COVID-19 vaccine doses per 100 persons have been administered worldwide, that same number for African continent is below 2. While some countries are nearing the finish lines when it comes to their vaccination campaigns, several African Union member states have not been able to vaccinate a single person. Many member states are struggling to protect at least those who are most at risk, including their frontline healthcare workers. At the same time, the threat which COVID-19 poses for the world and for Africa is not getting smaller. On the contrary, the recent developments in India are a grave warning and serves to remind all of us of the havoc this virus can cause. Several African Union member states are facing the beginning of new waves of the virus, and mortality rates are rising. There are many different reasons for global COVID-19 vaccine inequity, but there is only one answer. We must act now, act decisively, and act together. The African Union Vaccine Development and Access Strategy's goal of vaccinating at least 60% of our population remains the absolute minimum requirement. We aim to achieve this goal before the end of 2022. In order to achieve it, the African COVID-19 Vaccine Acquisition Task Team, or AVAC, is working to support financing and access to doses for the African Union member states to complement doses that will be made available through COVAX. The COVAX facility and especially the AMC are critical components of achieving the continental vaccination goal. We therefore urge those who can help us end this pandemic to do so by contributing to the AMC fundraising goal. I thank you.
COVAX is a unique coalition anchored in science, innovation, and collaboration. It is driven by a desire to do more, to fight the pandemic, but also to do it fast and to be fair for everyone. I am delighted to stand alongside you today as part of this remarkable effort. At AstraZeneca, we have always understood this was a global challenge, and we are proud to have already released almost 500 million vaccine doses to over 160 countries. We were the first manufacturer to commit to COVAX, and we have supplied 97% of doses so far, with over 70% going to low and middle income countries. Yet, the reality is that if we are to achieve our collective aim of vaccinating the world, international organizations, governments, healthcare leaders, industry, and civil society must do more to remove the barriers to progress. From our own experience, we know the challenges of increasing global capacity when expertise is in limited supply, and how restrictions in international trading create ripple effects through the supply chains. It is also clear that vaccine donations are essential. We welcome the Japanese government's pledge, and we are working with COVAX and other governments to unlock further supplies. Beyond this, we believe our approach of tech transfers to increase production and not-for-profit pricing provides an appropriate model for pandemic management. This is equitable access in action, demonstrating what public-private partnerships can do during a time that requires extraordinary measures. No one is safe until we are all safe, and together we can bring an end to this devastating pandemic.
Thank you all. We'll now hear the donor's perspective from the Minister for International Development Cooperation of Sweden, Per Olsson-Frid. Sweden is one of the original donors to Gavi and one of the largest donors to the COVAX AMC. Bronwyn, back to you.
I'm Bronwyn Nielsen, and I'm joined by Minister Per Olsson-Frid, who is Sweden's Minister for International Development Cooperation. Thank you so much, Minister, for joining the COVAX Advance Market Commitment. And this, of course, is in the auspices of the One World Protected Summit. It is now 12 months since the Advance Market Commitment launched on the 4th of June 2020, and 12 months we've learned many things over this COVID-19 period. Of course, we've also looked at resource deployment throughout this period, and we need to plan for 2022 in terms of lower income countries achieving equitable access to vaccines that are safe, that are reliable and efficient. And I suppose that's an appropriate part or place for us to start. Minister Frid, is give me a sense of what it means to you when we say equitable access to COVID-19 vaccines.
Pleasure to be here, pleasure to join you, of course. I think to me, what comes to mind is not only, of course, the role that vaccines can play in our ability to fight this pandemic and to deal with the health crisis that it is, but also this is about allowing countries to open up, to be part of a global economic recovery, to open up democratically again so people can meet and be part of public life, for children to come back to school and again be part of a lifelong learning. Equitable access to vaccines is far more than just fighting COVID-19, this virus. This is about getting the world back on its feet and not growing inequalities, but actually shrinking the differences and making this world better and fairer.
When it comes to equitable access to vaccines, of course, we also need to look at the balance between grants and domestic resources. Now, obviously, it's a very fine balancing act, but as a donor government, what are you looking for in particular when you look to deploying your grants?
First, we must, of course, I think we must acknowledge that we're, as we speak, in the middle of the greatest vaccine rollouts in the history of vaccines. And that is a great success. At the same time as less than 1% of the populations in the low-income countries have received these vaccines. And this is far from a success. So, of course, we need all the funding and all the support we can to COVAX AMC in order to have a fairer, better, more equitable distribution of vaccines. And as a donor, I am, of course, to think of how we can put an added value to the financial resources that we have able to put in. To us, Sweden, it was important very early on to think that we could, we use the IFM as a way to fund that allows us to contribute with funding over a 10-year period, but it allows COVAX to front load that money and use it almost immediately, which of course is very effective. But also from the start, for Sweden, this was not only about vaccines, but vaccinations. And this means that we also need resources to strengthen health systems and to equip health systems with the tools, with the knowledge, and with the personnel to actually carry out these vaccines. Because doses is not the only thing we need. We need also those shots in the arm. We need people to receive the vaccine. So yes, dollars, financial contribution is important, but not only to vaccines, but to the whole health system in order for this to work.
You know, the number on the table is between 10 billion to 23 billion US dollars. That's a tall ask for 2022. Give us a sense of how readily available that money is to deploy widely across the globe. And where it's going to come from, Minister Freed?
Very good question, because this pandemic hits all countries, and it also early on hit the OECD countries, the big donor countries, very hard. And there's been a hesitation among countries how much resources there are available for this type of projects. But as the pandemic has continued, I think many of us have understood that no one is safe and everyone is safe. And if we don't fight this pandemic everywhere, it will mutate and it will come back, and then it can hit us all again. And I think in that type of projection, also solidarity again grows. Solidarity that is not only something that you give, but also something that the other side of that coin is that you also gain yourself from it. So I think in that sense that countries are more ready today to actually contribute. And then we need different mechanisms that could fit different countries, enable them to contribute. We need dollars. We also need doses, in the sense that we need to roll out vaccines faster than what those dollars can be used. So countries who have an overload of vaccines also need to be ready for donations. But then again, we need delivery. So we don't need any more empty promises on that the world needs to stick together in this. But we need countries to step up and deliver on that promise.
So, Minister Freed, the other debate topic in the emerging market fold is the fear that if we don't step up with equitable vaccines, and as you say, also the actual administering of those vaccines, then the chasm between the developed and the emerging world will deepen, and we may never be able to repair it. I mean, this must be a huge risk when you look at it from your perspective.
Absolutely. One of the best things that came with this pandemic, if you allow me to say so, was that the world came together in a way that it hadn't done for a long time, and mobilized determination, mobilized financial resources around the Build Back Better and Greener agenda, where we promised in meetings after meetings to say that now is the time to build back our economy, build back this world more equal, more gender equal, more sustainable. What we have to understand is if we don't succeed with an equitable access to vaccines, the differences between countries, the inequalities between countries will grow. And that is not the economy that we wanted to build back. We wanted to have a more inclusive recovery. And therefore, I think we need to mobilize. And I think this COVAX has shown that it gives results. And now more countries, more donors need to step up and contribute the way they can, as much as they can, so that we don't leave developing countries and populations with those empty promises of a building back better and greener world, but that we can also deliver on that.
Do you feel that the political will is there from the developed countries, those countries that have the ability to allow for grants in the lower income countries? Are you satisfied with the political will that you are seeing, sir?
I don't think anyone can feel satisfied at this point with this unequal and inequity among in terms of vaccine distribution. We shouldn't be satisfied until everyone's safe. And we have a long way to go. But we need to keep pushing, and we need to stay positive, because of course it's possible to achieve these results. But then we have to come together. More countries need to come in and contribute.
And ultimately, do you believe that we can build back better, as you put it, if we see that urgent collaborative support?
Absolutely. No, I'm a positive person in that sense, and I see also we have the largest generation of young people in the world today, and we see they are ready to step up and take responsibility to build back a more democratic, inclusive world, a more sustainable world. And we now we have now given them, such an impossible task if we cannot save this world from the pandemic. We know and we have the tools. We definitely have the resources. Let's now distribute those resources and those vaccines in a better way, and then we can start building back better. And I'm sure we can do so. But again, we don't need empty promises on that. We need delivery.
Minister Fried, thank you very much for sharing your insights and for the sense of urgency, sir, that you bring to today's platform. It has certainly been a pleasure. Minister Per Olsen Fried is Sweden's Minister for International Development Cooperation.
Thank you very much. It was a pleasure to join you.
Thank you very much, sir.
Thank you, Minister Fried. As a long-term investor in development, Sweden's support and endorsement is critical to achieving our shared goals. I'm now pleased to give the floor to Mamta Murthy, Vice President for Human Development of the World Bank Group, followed by Gavi's Managing Director for Resource Mobilization, Private Sector Partnerships and Innovative Finance, Marie-Ange Sarakayao. For this, let me hand over to financial journalist Arabile Gumede.
Hello, my name is Arabile Gumede, and as we continue our look into financing the future of the COVAX, I'm delighted to be joined by Mamta Murthy, who is Vice President for Human Development at the World Bank. The World Bank responded rapidly to the pandemic in 2020, setting aside last October $12 billion package, and that was to help countries respond to vaccines, testing, and even treatments. Now, the urgent need, decisive action, that was very clear, particularly by the bank's own estimates. They have 150 million people who will be driven back into extreme poverty as a result of the pandemic. Many of these will be people who have only recently even just escaped poverty. It is a reminder then that COVID-19 represents not only the greatest public health challenge of our time, but also the economic one. Mamta, again, thank you so much for joining us today. Gavi and the World Bank have been partners since the Vaccine Alliance was established back in the year 2000. Both organizations clearly share the same fundamental vision, right? And that is to improve people's lives and to provide the commodities and infrastructure to kind of underpin long-term sustainable economic growth. All the progress made in recent years is now, of course, at risk as a result of this pandemic. In the bank's view, what is needed now to put countries back on a sustainable trajectory, particularly for long-term health and that impact?
Thank you, Arabile, for this really important question. You emphasized that the World Bank is a founding partner of Gavi, and we've worked very closely with them to strengthen health systems globally. And of course, we're working with them now on this largest ever rollout of vaccinations in history. But this is taking place in the context of a pandemic that is really ravaging the developing world. And of course, we are very concerned. In addition to the loss of lives, we're concerned by the fact that routine immunizations are being missed. We're concerned about the fact that many women cannot get reproductive health services. We're concerned about the missed appointments and treatment of non-communicable diseases, the rise of malnutrition, and more. And all of this is likely to have long-term impacts on people in the developing world and on their opportunities to go on to live fulfilling and productive lives. And that's why it's so important to bring an end to this pandemic. Now, in response to the pandemic, as the World Bank, we have mounted the largest ever crisis response in history, and in our history. And this has involved over $40 billion of support for developing countries. It started with supporting the emergency health response. So resources so that countries could purchase PPE, diagnostic tests, medical equipment, and of course supporting their healthcare workers for frontline response. The resources were also to expand safety nets and cash transfers so that people whose incomes had stopped could receive support. The resources are also to support private sector development and as well as to support governments who needed resources to put in place policies and investments to respond to the pandemic. So I would say that it's very important that this kind of support continue. So both international agencies, partners, and governments themselves continue to work on responding to the pandemic with all the resources that they can bring to bear. There continues to be the need to support public health measures and testing and treatment. In addition, of course, developing countries need access to vaccines.
Look, if you needed any clearer example of just how global and how fast moving this pandemic is, just look at how we're having this conversation from 3 different parts of the world that are just as ravaged by this pandemic and hurt by it in multiple different ways. And that kind of tells you the story of just how immediate the response sort of needed to be, how impactful things have needed to or have become, really, and how much need there will be for consistent help moving forward. Now, Murthy, we recently outlined the latest bank thinking on how we vaccinate every country, resting particularly on 3 pillars, those being the fulfilling of commitments, the ones that you've, of course, laid out even for, contractual transparency, which is quite a significant one, as well as increasing vaccine production. As we try to look even beyond 2021, with perhaps COVID-19 still, of course, there, and to what we hope will be an end to the acute phase of COVID-19, how can we best prepare them for 2022? What is needed? And how do we then take perhaps a leap forward?
So I would say, first of all, that it remains the case that without bringing the pandemic under control, millions of additional people will be pushed into extreme poverty. And this is something that needs to be a guiding principle for us. We need to bring the economies of the world back on track, and that means bringing the pandemic under control. Now, as you've said, there are really 3 elements that we see, and it's very important that this continues in order into 2022, in order to fully have the pandemic under control. The first is the commitment of financing. And events such as this one, which are trying to ensure that there is enough money for the Gavi AMC, are extremely important. On our side, we have already committed $2.4 billion in nearly 20 countries to support acquisition and deployment of COVID-19 vaccines. And we expect to reach 4 billion by the middle of the year. And this is an effort that we intend to keep up and continue. We're also trying to aggregate the demand from countries that can be financed by the World Bank and make sure that Gavi and COVAX have visibility on this demand so that they can make purchases for vaccines beyond the 20% that will be financed through donor contributions. Now, it's clear that while financing is needed, it's not the only part of the story. This financing is really so that developing countries can get in the queue for COVID-19 vaccines, because it is the case that the majority of vaccine availability is really now available in the richer countries of the world. And with the expansion of vaccinations for children and boosters, we are very concerned, as are other partners, that developing countries will continue to be at the back of the queue. And that's why we are strongly advocating for the donation of surplus vaccines so that vaccines can become available earlier in developing countries. And there are many ways in which these donations can be made. We are advocating that the donations be made through COVAX so that the commitment that has been made to provide 20% coverage of the population in developing countries can be fulfilled. That's the first part of the story. The second part of the story is really around expanding manufacturing. And here our private sector arm, the International Finance Corporation, has already made investments of about $1 billion in medical services and in manufacturing so that the kinds of equipment and services that are needed to respond to COVID-19 are provided. And these investments are in developing countries, including in sub-Saharan Africa. In addition to the $1 billion or so investments that have been made, they have a $4 billion platform that they are further putting to the service of developing countries. IFC is also looking to make early investments, at-risk investments in promising medical technologies, including vaccines and medical services, to alleviate the worldwide shortage of vaccines. The final point I would make is really around transparency. And here we've been advocating that governments, manufacturers, agencies that are involved in the production and the delivery of vaccines really be very transparent about what capacity has been installed and is available and what doses have been contracted. I think this allows for much greater clarity on what supply is available, what has been contracted, and what remains. And that's why with Gavi, with UNICEF, WHO, Global Fund, we engaged in producing assessments of readiness for vaccine deployment. We've done this in over 140 countries in partnership with the countries. And it's extremely important that countries work on being ready to deploy vaccines.
Very quickly then, Mamta, if you will, how can the bank and Gavi or COVAX then leverage innovative financing upfront in order to tackle the issue at hand, in summary, you think?
I would say that we've learned a lot through this crisis response. We've learned that prevention is better than cure. If a country and the international community is prepared, it's much easier to respond. That's the first thing I would say. So investment in preparation and in preparedness. The second thing we've learned is that a crisis response has to be multi-sectoral. So it starts with a One Health approach, right? We have to look at animal health and human health and health of the environment. After all, we're talking about a zoonotic disease that leapt from animals to humans. So being prepared in terms of monitoring, surveillance, treatment. But we need to also go and think about resilience of systems. We need to support education systems in such a way that they can be resilient to a lockdown. We need to make sure that countries are in a position to provide cash benefits to people in the event of a lockdown. We need infrastructure, especially digital infrastructure, to make sure that countries can respond to a future pandemic. So I would say that preparation, cross-sectoral support, and making sure that there is financing that can be triggered and can surge in response to a pandemic is what is needed. We have some experience doing this at the World Bank, and we'd be very happy to make this expertise available to all as we discuss how to fight this pandemic and how to be better prepared for the next one.
All right, Mamta, thank you so much for that. Really, really appreciate it. I think the conversation kind of tells you exactly where we need to go, and the sense of urgency does definitely come through. I now want to turn to Marianne Saraka-Yao, who is the Managing Director for Resource Mobilization, Private Sector Partnerships, as well as Innovative Finance at Gavi. Marianne, welcome. Thank you so much for the time. Really appreciate it. I suppose I can start off with you by then just noting out how Gavi has been a central investor in immunization programs since 2000. In doing this, it has developed a number of particularly innovative instruments that allow donors to front load their impact and investment. Are the existing financial instruments that are available to you adequate for the task of funding the COVAX AMC, or is perhaps further innovation in particular needed?
Thank you, Arabile. Over its existence, Gavi has actually developed two innovative finance instruments that have proved extremely useful in our response to the pandemic. First, the Advanced Market Commitment Against Pneumonia, which was developed almost 10 years ago, allowed us really to jumpstart vaccine production and the availability of vaccines for low and middle income countries. It was actually the first time that we were able to provide a vaccine at the same time in low middle income countries as in higher economies. So thanks to that experience, we actually were able to bring this AMC at a larger scale and called it the Gavi COVAX AMC. And from there, we were able to jumpstart our response, and the vaccine that you saw delivered in February in low and middle income countries were actually really dependent on that early start from the AMC. The second instrument that has proved invaluable from what we hear from donors are the vaccine bonds. These vaccine bonds allow us to use donor commitments over a long period, let's say 20 years, and we are able to go today to the capital markets and cash these bonds and are able then to buy vaccines. So with these two instruments, we're able early on to reserve vaccines, help develop capacity, and hence start our response to COVID-19. For donors, it also allows them to actually spread over time their expenses and also be able also to serve other development needs, and for countries to have an immediate response because they don't have to wait for 10, 20 years to get that money, but we are able to serve it immediately.
Yeah. Marianne, do you think then all of these innovations will have a long-lasting impact on the way we fund vaccines in future?
We are really hopeful for this. Really, Arabile, what is critical now is really to be able to stretch donor money with the domestic resource mobilization, meaning the money coming from the countries, and be able also to tap the capital markets. So it's really finding this balance between donor leveraging, domestic resource mobilization, and tapping private markets. And we are hoping that with this combination, we are able to have one, upfront funding, contingent funding, so that we are able to respond immediately. Had we had, contingent funding at the time the epidemic broke last year, would have been able to have a much stronger response. And possibly, the type of, virus and variant that you are seeing today, we have been able to tackle it earlier. So definitely we are really looking at innovating further, but the response already and these instruments have already changed the landscape. And given the response and the demand we see for this instrument, we are very hopeful.
Marianne, couldn't have said it better myself. Thank you so much for that. I think it does paint a clearer picture. It is clear that there's still a lot of work still ahead for us, of course, and it is clear that whatever innovations we introduce to finance the recovery, they will need to be sustainable and they will need to also be very, very inclusive.
Well, thank you both. Marianne, you did emphasize the need for funding and innovative financing and the urgency, therefore, as we prepare for 2022. You know what? This really resonates with me, and I'm sure it will with many in the audience too. Well, it's now time to hear from some other world leaders who are joining us here today as we look back on 1 year of the AMC and, most importantly, look ahead to the role it will play in helping end the pandemic. It's now my honor to hand over to His Excellency Motegi Toshimitsu, Minister for Foreign Affairs of Japan, who will commence proceedings at 1300 CEST.
1 year ago this week, Gavi launched the COVAX Advanced Market Commitment, an innovative solution for an unprecedented pandemic, designed to ensure no country misses out on vaccines that offer us all a route back to normality. 12 months later, COVAX has a long list of accomplishments. Vaccines have been approved for use. Countries are ready to receive them. A scheme to help people access compensation is in place, and 1.3 billion doses are contracted to COVAX. But we now face a fork in the road. Down one road lies a two-tier world in which the pandemic continues to rage, economies continue to be hit, the vulnerable are thrown into extreme poverty, and variants continue to evolve. The COVAX AMC can help put us on another path in which we defeat this virus together, united. But to do this, the AMC needs urgent resources. It needs long-term financing to help the AMC evolve as the pandemic evolves. It needs urgent doses donated from countries with vaccines to spare. And it needs the collective will of governments, financiers, civil society, and vaccine manufacturers to leave no one behind. COVAX is committed to deliver.
Good morning, good afternoon, and good evening. Thank you for joining the COVAX AMC Summit. 1 year has passed since the launch of the COVAX facility. I'd like to express my sincere appreciation for the effort by Gavi, each country, and organization. We are now at a critical moment in our fight against the pandemic, and the role of COVAX has become increasingly important. Thank you again for your strong commitment to meet the expectations. From here, I will speak in Japanese.
The situation surrounding COVID-19 continues to be challenging. But there is also encouraging news in these difficult times. That is, just like you who are present at this summit today, more countries and organizations towards the goal of ensuring equitable access to vaccines. In April, the US government and Gavi co-hosted the Gavi COVAX One World Protected event, which raised around $350 million. I would like to express my respect for the leadership of the US government in this regard. As participants in COVAX, we are committed to securing 1.6 billion doses of vaccines to cover 30% of the population of AMC-eligible economies and to delivering them to those who are waiting for vaccines in the world. To fulfill this goal, there was a funding gap of approximately $1.7 billion at the end of the Gavi COVAX AMC One World Protected event in April. There is a need to close the funding gap as soon as possible, and I look forward to further cooperation from you at today's summit. Consequently, I expect that we will find ourselves at the next stage in securing equitable access to vaccines 2 hours from now. And now, I have the great pleasure of introducing the co-host of today's summit, His Excellency Mr. Suga Yoshihide, Prime Minister, to deliver the opening address.
Excellencies, distinguished guests, ladies and gentlemen, thank you very much for your participation in the COVAX AMC Summit today. I would like to extend a very warm welcome to all of you. I am very honored to co-host this summit together with His Excellency Professor Jose Manuel Barroso, Gavi Board Chair, First, I would like to express my heartfelt condolences for those who have passed away due to the COVID-19 pandemic. I would also like to express my deepest respect for all health and medical professionals who are at the forefront of the fight against the pandemic. Every country is doing its utmost to tackle the pandemic, but the battle has been slow, experiencing alternating periods of progress and retreat. Against this backdrop, and with a strong sense of purpose, I am determined to make this COVAX AMC Summit a success and achieve significant progress together with you in realizing equitable access to vaccines. We must not allow a country's specific situation or economic power to determine its access to vaccines. Based on this belief, the COVAX facility was launched last year in order to realize equitable access to vaccines everywhere in the world, including in developing countries. Through this unique international cooperation mechanism, vaccine doses have rapidly been provided, and more than 76 million doses have already been delivered to over 120 economies. This is an unprecedented achievement by the international community working together. I would like to express my respect for the dedication of His Excellency Professor Barroso, Gavi Board Chair, Dr. Berkley, Gavi CEO, and all the people who made this possible. However, in order to overcome the crisis we now face, we need further solidarity and commitment. More than a year has passed since the COVID-19 pandemic began. Now, over 170 million people have been infected, and of those, over 3.5 million lost their lives. COVID-19 continues to have a tremendous impact on social and economic activities of each country. In order to deliver more doses of vaccines, which is the key to overcoming this critical phase of the pandemic, contributions in both forms of additional funding and those sharing from countries that have already secured many doses are essential. Furthermore, with a view to achieving universal health coverage guided by the principle of human security, Japan fully supports efforts to ensure equitable access to safe and effective vaccines for as many people as possible. I would like to invite you to take a firm step forward today to secure 1.8 billion vaccine doses to protect nearly 30% of the population in AMC-eligible economies. Let me conclude my remarks by wishing that this summit will bring hope to the world in overcoming COVID-19 and building back better. Thank you very much for your attention.
Thank you, Prime Minister Suga. The next speakers are UN Secretary General Antonio Guterres and President Ursula von der Leyen of the European Commission. Secretary General Guterres will now address.
Good morning, good afternoon, and good evening. I thank His Excellency Yoshihide Suga, Prime Minister of Japan, and José Manuel Barroso, Chair of the Gavi Board, for hosting this critical COVAX Advanced Market Commitment Summit. And I thank everyone attending for your commitment and solidarity. Vaccines, together with public health measures, offer real hope of bringing the COVID-19 pandemic under control. But the pandemic will not be over anywhere until it is over everywhere. And that means getting vaccines to every country as quickly and equitably as possible. To date, 10 countries have administered more than 75% of all COVID-19 vaccines. But in poorer countries, even health workers and people with underlying conditions cannot access them. This is not only manifestly unjust, it is also self-defeating. It's not too late to turn the situation around. Today's meeting is at the heart of efforts to secure a sustainable vaccine supply that is shared equitably. Global leaders from China to Europe and the United States have talked of waging war against the virus. I fully agree. That means mobilizing the global economy and putting it on a war footing to finance the fight. The ACT Accelerator and its COVAX Advanced Market Commitment is one of the best weapons we have, a tried and tested way to get vaccines to low-income countries. COVAX has already delivered over 72 million doses to 125 countries. But that is far less than 172 million it should have delivered by now. With an additional $1.6 billion, COVAX could deliver up to 1.8 billion doses to low and middle income countries this year. This is the game changer we need to get ahead of the pandemic. I also urge countries to share vaccines through COVAX immediately to cover interruptions in supply. We need a true vaccination plan. And for that purpose, I advocated at the G20 and the World Health Assembly for a global task force that brings together all countries with vaccine production capacities, the World Health Organization, the ACT Accelerator partners, and international financial institutions able to deal with the pharmaceutical companies and other key stakeholders. The G20 task force should be co-convened at the highest levels by the major powers who hold most of the global supply and production capacity together with the multilateral system. It should aim at least double manufacturing capacity by exploring all options, from voluntary licenses and technology transfers to patent pooling and flexibility on intellectual property rights. And of course, it should use the COVAX facility to address equitable global distribution. I'm ready to mobilize the entire United Nations system to support these efforts. By working together, national leaders, the private sector, and civil society can chart a faster, more equitable course out of the COVID-19 pandemic. Let's do everything we can to protect people and end the pandemic. Thank you.
Prime Minister Suga, dear Yoshihide, thank you for hosting this important summit. To accelerate safe and effective vaccination everywhere, we all need to step up efforts. Therefore, I appreciate that leaders at the G20 Global Health Summit in May committed to working closely together. This is the only way to get out of the current crisis and to prevent a new pandemic. COVAX plays a central role in this. Europe is investing in COVAX both financially and by sharing vaccines, because we believe this is the best way to ensure universal, fair and affordable access to COVID-19 vaccines. Our common goal is to leave no one behind. That we promised more than 1 year ago when we launched COVAX, and this is still true today. Team Europe has been a lead supporter of COVAX since the start. More than 1/3 of COVAX funding comes from Team Europe. The European Union has mobilized 2.8 billion euros so far. I'm glad that others have joined our efforts. COVAX has delivered over 71 million doses in 125 countries to date, including to countries like Afghanistan or Yemen, where there is little chance of vaccines arriving without COVAX. This shows the strength of multilateralism and collective solutions. But there is still a lot of work to be done. Today, wealthier countries are vaccinating much faster than others, but the world will not overcome the pandemic if these differences stay. No one will be safe until everyone is safe. Team Europe has just committed to donate at least 100 million doses to low and middle income countries by the end of the year. Most of these will be delivered through COVAX. The EU vaccine strategy is delivering not only for Europeans, but also for the rest of the world. I trust more will come as soon as deliveries pick up. I'm particularly grateful that the EU's industrial partners have committed themselves too. They will make available 1.3 billion doses in 2021. BioNTech, Pfizer, Johnson & Johnson, and Moderna will provide these vaccines at no profit for the low-income countries and at lower prices for the middle-income countries. and they will supply an additional 1 billion or more doses in 2022. It's in our mutual interest to end this global pandemic as soon as possible. And that is why the European Union, together with the European Investment Bank, will reorient 300 million euro to COVAX. This is Team Europe's contribution to AVAT, COVAX cost-sharing rapid finance scheme. This scheme will help vaccine purchases in Africa, and it will foster links between COVAX and the African Union. You can continue to count on Team Europe's commitment. We are here for the long haul. We are here until we end the pandemic everywhere. Thank you very much.
Thank you, Secretary General Guterres and President von der Leyen. Obrigado. Dankeschön. The next speakers are Prime Minister Erna Solberg of Norway, President Paul Kagame of Rwanda, and Vice President Kamala Harris of the United States of America. Prime Minister Solberg, you have the floor.
Excellencies, ladies and gentlemen, friends. First, I would like to thank Gavi and the government of Japan for hosting this event. To beat the pandemic, we need to speed up COVID-19 vaccination. Vaccination coverage is currently lowest in the poorest countries. We need to correct the inequality in vaccine rollout. COVAX is our best bet to get jabs into arms worldwide. A fully financed COVAX AMC is crucial. As co-chairs of the ACT-A Facilitation Council, President Ramaphosa and I have reached out to leaders in 89 countries. We have asked each country to do its part and to contribute its fair share to ACT-A. And Norway is doing its part. We have contributed $500 million to ACT-A, including $141 million to the COVAX AMC. In addition, we will share surplus vaccines. Our current plan is to share 5 million vaccine doses, 1 per capita. We hope other countries will also share doses through COVAX. New viral strains makes it clear that we need to move forward quickly. By working together, we can ensure equitable and rapid access to vaccines. To end this pandemic, we need a fully financed ACT-A and COVAX now.
Excellencies, distinguished ladies and gentlemen, first, I would like to commend Prime Minister Yoshihide Suga and the Gavi Board Chair Jose Manuel Barroso for convening this summit. The COVAX initiative has already saved many lives, including in Rwanda. Our country has received more than 500,000 doses via COVAX, allowing us to vaccinate nearly 3% of our population. Tens of millions of doses have been delivered worldwide. I commend Gavi, the World Health Organization, and CEPI for the good work done so far. However, billions of people are still exposed to the dangers of COVID-19. The shortfall in Africa is particularly acute. We must redouble our efforts and also diversify the sources of vaccine available to COVAX, even as we work to build Africa's vaccine production capacity for the future. The COVAX Advanced Market Commitment, led by Gavi, is the financing mechanism that ensures vaccine access for low and middle income countries. Now is the time to ensure COVAX has the funds to keep saving lives and helping bring the COVID-19 pandemic to an end. Thank you for your kind attention.
Greetings to your excellencies, distinguished colleagues, and esteemed leaders of the international community. I want to extend my gratitude to Prime Minister Suga and Gavi, the Vaccine Alliance, for convening this summit. The global pandemic has made it clear that our world is interconnected, our world is interdependent, our world is fragile. And if we didn't know already, we now know. Our collective future depends on our collective response to the global crises. Today, we have safe and effective vaccines that are working to prevent the spread of COVID-19. And the challenge before us is to provide equal access. COVAX was established to make sure these life-saving vaccines get to every nation. That is why so many of the leaders gathered here have committed to support COVAX. Thank you all. At the One World Protected virtual event in April, we raised $386 million for COVAX. Since then, global leaders from the public and private sectors have raised $700 million more. For our part, the United States has contributed $2 billion to Gavi for COVAX. And we have pledged an additional $2 billion through 2022. At this summit, we hope to raise enough for COVAX to secure the supply it needs to vaccinate people in need. It is a big goal. It is an important goal. And today, I am asking leaders to help us meet this goal at this moment. Here's the truth. People are still contracting COVID-19. People are still dying every day. And that is why we must work together to get people vaccinated as quickly as possible in every nation throughout the world. It is a big job, and I know that our global community is up to it. Thank you all.
Thank you, Prime Minister Solberg, President Kagame, and Vice President Harris. At the end of this opening session, we would like to have a few words from Professor Jose Manuel Barroso, Chair of the Gavi Board, who is co-hosting this event. I'd like to ask Professor Barroso to speak to us. Please.
Thank you very much, Mr. Minister. Excellencies, ladies and gentlemen, as Chairman of the Gavi Board, I would like to welcome you and thank the government of Japan for hosting this summit today. Very special and sincere word of gratitude to Prime Minister Suga. His leadership and personal commitment to advance the COVAX facility are really outstanding. Under the leadership of Gavi, WHO, CEPI, and UNICEF, and with the support of 192 governments, this remarkable multilateral mechanism called COVAX aims to ensure that people of all countries have equitable access to COVID-19 vaccines, in particular, the 92 lower-income economies that would otherwise be unable to afford them. It's a model that works. With the first jabs administered to people in COVAX AMC countries in Africa just 83 days after people in high-income countries first started receiving them. As of today, vaccines have been rolled out to 126 countries, but these are only the first of at least 1.3 billion doses to be delivered through COVAX AMC in 2021. We urgently need to reach more people and reach them faster. We need more ambition to have one world protected. And this summit is a huge opportunity to accelerate access to COVAX doses to people in these 92 countries. It is the opportunity to make things right, to make history by galvanizing the support already expressed for COVAX. To do this, our task here today is very clear. We urgently need to raise an additional $2 billion to close the financing gap needed to accelerate access to 1.8 billion COVID-19 vaccine doses for people in lower-income economies. And we believe that together with sharing of surplus doses, this will be decisive to put an end globally to the acute phase of the pandemic by early next year. I thank you again, and I look forward to a successful summit today.
I'd like to thank all the speakers in the opening session, which underscored the value of COVAX and the importance of financial support, as well as dose sharing. Let us move on to the session on 1-year anniversary of the COVAX Advanced Market Commitment. We have 6 distinguished speakers. I'd like to welcome representatives from international organizations. First, I'd like to ask Dr. Tedros, Director General of WHO, to speak to us. We will be followed by Ms. Henrietta Fore, Executive Director of UNICEF, Dr. Seth Berkley, CEO of Gavi, and Richard Hatchett, CEO of CEPI. Dr. Tedros, you have the floor.
Thank you so much, Foreign Minister Motegi. Arigato gozaimasu. Excellencies, dear colleagues and friends. First, I would like to thank Japan and Prime Minister Suga for hosting this summit. And again, arigato gozaimasu. Japan is a steadfast leader on global health, from universal health coverage to COVID-19. A year ago, COVAX began as a groundbreaking global partnership, pooling risk and driving equity. So far, we have delivered almost 78 million doses to 127 countries and economies since February, from remote islands to conflict zones. But of the 1.8 billion vaccines administered globally, just 0.4% have been administered in low-income countries. This is ethically, epidemiologically, and economically unacceptable. At the World Health Assembly last week, I called for a massive global effort to vaccinate at least 10% of the population of every country by the end of September, and at least 30% by the end of the year. COVAX is key for achieving these targets. To achieve them, we need doses to be shared right now, today, through COVAX. We need COVAX to be fully financed to ensure a diverse portfolio that meets countries' needs. We need export restrictions to be lifted. We need companies to prioritize COVAX, and we need to support receiving countries to use doses immediately. Vaccines are a key tool, but they're not the only tool. Countries also need tests, treatments, and other supplies, and the health systems to deliver them. Countries with the highest vaccination coverage are now seeing a significant decline in cases and deaths. To end the pandemic, we must end vaccine inequity. Investing in COVAX is not charity. It's the best investment in ending the pandemic and driving a truly global recovery. Foreign Minister, arigato gozaimasu again. Thank you so much.
In the midst of an unprecedented global health crisis, COVAX set the audacious goal of delivering 2 billion doses of the COVID vaccine in 2021. And COVAX works. So far, we've delivered doses to 125 countries, from remote islands to war zones to rural communities and to crowded urban slums. But as we approach mid-year, we are seeing a catastrophic surge across India and South Asia, a disaster for children and families relying on already fragile health systems, and for the world, which now faces a shortage of available vaccines. Equal access to vaccination still represents the best pathway for the global pandemic. COVAX is set up to do this, but this vital lifeline now needs one of its own. We need countries to fully fund the COVAX Advanced Market Commitment and dedicate funding for vaccine rollouts. Let's get vaccines off the tarmac and into arms. We cannot allow a single vial to go to waste. We urge well-supplied countries to share doses. Help us close the supply gap and keep vulnerable countries from becoming the next global hotspot. And help us deliver COVID vaccines in parallel with other routine immunizations and health services. Our fight against one deadly disease cannot come at the expense of another. The global vaccination race will be won or lost together. So let us make sure that we all win.
1 year ago at the Global Vaccine Summit, I said there was no scenario in which the supply of COVID-19 vaccines over the next 18 months would exceed the demand. But nevertheless, there may be scenarios in which it would be possible to end the acute phase of the pandemic by 2021. Today, we are potentially living in such a scenario. 1 year ago, we did not have safe and effective COVID-19 vaccines. Those would have been months away. We have no assurance of successful vaccine candidates. Cases were continuing to grow globally, and we had raised only a fraction of the funds required for the Gavi COVAX AMC. 1 year later, we've made astonishing progress. Today, we have not one, but 15 different vaccines in use globally. We have raised $7 billion for the Gavi COVAX AMC, and our generous donors will announce additional contributions today. Most importantly, COVAX has delivered 77 million vaccines to 126 participating countries and economies. Each of these jabs is a small victory for equitable access. They also affirm the resilience and dedication of our partners in Gavi COVAX AMC countries, who more than anyone know that we must insist on equity. Now, while we should celebrate our collective achievements, it is not good enough, and the work ahead of us is immense. For COVAX to be successful, we need not merely to deliver doses, but to deliver them rapidly. In a pandemic, timing is everything. Millions of lives are at stake. Our partners in COVAX AMC countries have felt the impact of global vaccine supply constraints on lives and livelihoods. It's not acceptable that high-income countries have vaccinated, on average, more than 1/3 of their populations, whereas low-income countries are less than 1%. The longer this goes on, the more loss and suffering the world will endure. We now have a narrow window of opportunity, and we must redouble our efforts. On a global level, we need donors to finance the procurement of hundreds of millions of more doses. We need wealthy countries to share additional vaccines or allow COVAX to move up the manufacturing queue. And we need pharmaceutical companies to continue to share technologies with one another to scale up production. On a local level, we must continue coordinating with AMC countries to strengthen delivery systems. And we need to continue building trust so that people know that COVAX-delivered vaccines are safe and effective. In my remarks 1 year ago, I also said that ending the acute phase of this pandemic should be the highest priority of all countries. This continues to be true today. As wealthy countries begin a return to fuller economic activity, we cannot forget that ignoring the pandemic elsewhere is equivalent to saying your side of the boat is sinking. We need to end the pandemic together as one global community. Thank you, Prime Minister Suga, for Japan's great leadership in promoting vaccine equity. And thank you to everyone who is working tirelessly to save lives and protect the future.
Excellencies, colleagues, ladies and gentlemen, the value of vaccines in breaking chains of transmission, preventing hospitalizations, and saving lives in countries that have access to them is now indisputable. This is the result of a staggering global scientific effort, the success of which has surpassed all of our expectations. At CEPI, as the lead COVAX partner for research and development, we're funding additional vaccine candidates through late-stage clinical trials, including vaccines targeting variants of concern, which we're hopeful will produce hundreds of millions of additional doses for COVAX. We're also investing in clinical studies, like mix and match studies, to help us maximize the benefit from every dose of vaccine available. But the devastating surge of cases in India is a sobering and terrifying reminder of what this virus is capable of. The emergence of new and more transmissible COVID-19 variants makes achieving fair global access to vaccines to protect the most vulnerable, reduce the prevalence of disease, and slow viral mutation more important than ever. To end the acute phase of the pandemic as quickly as possible, we must empower COVAX to deliver to its full potential. If we don't, we will leave billions behind. COVAX has proven that the mechanism works. It has already delivered more than 70 million doses to more than 120 countries and participants. What we need now is access to doses. COVAX is working across many domains and through a new manufacturing task force to increase its supply of vaccine. And today, we are calling on the global community to help COVAX deliver to its full potential by sharing doses urgently, unblocking supply chains, and crucially, enabling COVAX to buy more doses now for low-income countries by fully funding the advanced market commitment. Our success is only possible thanks to the generosity of our partners and donors, and I thank you in advance for your support.
ありがとうございます。Thank you, Dr. Tedros, Ms. Ford, Dr. Berkley, and Dr. Hadgett. At the end of this session, I'll invite Foreign Secretary Dominic Raab of the United Kingdom, followed by Mr. Bill Gates, co-chair of the Bill and Melinda Gates Foundation. Dominic, over to you.
A year ago, almost to the day, the UK hosted the first Global Vaccine Summit. It raised a total of $8.8 billion to support immunization right around the world. And it launched the COVAX Advanced Market Commitment. And I want to thank Japan and Gavi for co-hosting today's summit and contributing to this incredibly important work. COVAX has achieved a huge amount in the last 12 months. Over 125 countries and territories have been reached, the majority of which have received vaccines funded through COVAX AMC. And it's also worth noting that around 98% of all vaccine doses distributed through COVAX have been produced by AstraZeneca. And I say that because it's a testament to the strength of British scientific expertise and to the importance of international collaboration. Britain was one of the earliest and largest COVAX donors. We provided over £500 million for the scheme. We used match funding to help raise $1 billion from other donors. And in February, through our presidency of the United Nations Security Council, we passed a resolution calling for a global vaccine ceasefire so that vaccines could take place in conflict zones to get to the most vulnerable. We're also championing COVAX and equitable access to vaccines through our G7 presidency. And these issues will be at the top of the agenda when leaders gather at the G7 summit in Cornwall just next week. And although a lot of progress has been made, we've still got a long way to go. So we must urgently increase the supply of vaccines around the world. And that's why we're working with industry, with other partners to scale up the manufacturing and resolve some of the bottlenecks that we've seen in supply. We must also recognise the risk posed by new variants. Prime Minister Boris Johnson recently announced plans for a global pandemic radar. And that will help save lives and protect health systems by spotting the diseases before they cause future pandemics, by enabling the rapid deployment of vaccines, treatments and tests. And we're also sharing our expertise in genomic sequencing to support countries to identify, assess and track new COVID variants. And finally, as the UK has done, we must all make sure that we disperse our commitments as swiftly as possible to allow COVAX to secure the vaccine deals that it needs. We must direct all of our expertise and all of the energies of the international community to move quickly together to beat this pandemic once and for all. The UK will play a full role in that effort.
Hello, everyone. Thank you to Prime Minister Suga and the people of Japan for hosting this summit and for your generous contributions to Gavi and to the COVAX AMC. Japan was one of the first nations to join COVAX and has been a strong champion of universal health coverage. Thank you. Also, thanks to everyone for supporting COVAX at this critical moment. I'm enormously proud that our foundation is a founding member of Gavi, the Vaccine Alliance, and 20 years later, it remains our foundation's largest grantee. This year has reminded all of us how transformative vaccines are. Thanks to extraordinary scientific collaboration, we now have several COVID vaccines to lead us out of this pandemic. The task now is to ensure everyone benefits. Sadly, the world has not yet lived up to that collective responsibility. More than 80% of the first billion shots went to people in wealthy countries. Only 0.2% went to low-income countries. We must do better. Each time the virus infects someone, it has a chance to mutate. No one is completely safe from COVID-19 until everyone has the same access to vaccines. That's why our foundation has committed over $250 million to support COVID-19 vaccine research and the COVAX AMC. And we've also provided at-risk funding to accelerate manufacturing even before we knew which vaccines would work. But much more is needed. We must raise more funds for COVAX to help this work go full speed. High-income countries have reserved more vaccines than they need. So without compromising their own domestic vaccination efforts, these countries can be part of the effort to accelerate global vaccine access by sharing the excess doses. I encourage these nations to be bold and commit as soon as possible to sharing over 1 billion doses in 2021, mostly through Gavi's COVAX AMC. For countries introducing the vaccines, we need your public health champions to mobilize and ensure that delivery systems are in place to reach everyone. Reaching everyone with vaccines, no matter where they live, is a cornerstone for our foundation, and we will continue to support innovative R&D and effective delivery models. We also hope to see more global manufacturing capacity that is not concentrated in just a few countries. Vaccines do so much good. Let's make sure everyone benefits from them. Thank you.
Let us move on to the first part of the pledging session, the core of today's summit. First, we will receive Prime Minister Suga on behalf of the government of Japan. Prime Minister Suga, please.
Thank you, Minister Motegi. Excellencies, distinguished guests, ladies and gentlemen, now is the time for us to act. I am determined to lead collective efforts of the international community to achieve our goal. Japan has led the discussion to establish the COVAX facility mechanism. Japan was the first country to actually disburse its contribution to the COVAX facility, amounting to $200 million so far. Today, I'm happy to announce that we will make an additional contribution of $800 million, which brings the total contribution of $1 billion to the COVAX facility. This is an unprecedented and largest ever contribution to the COVAX facility from Japan, which accounts for a large part of the remaining funding gap. Additionally, considering the harsh reality of the spread of new variants and lagging vaccine supply, I am pleased to announce that when circumstances allow and at an appropriate time, Japan intends to provide around 30 million doses of vaccines manufactured in Japan, including through the COVAX facility, to other countries and regions. I made this decision hoping to deliver vaccines, a ray of hope, to as many people as possible and as early as possible throughout the world in an equitable manner. Moreover, based on the new national strategy that was set yesterday, Japan will contribute to forming a global consensus on the evaluation method for new vaccines. We will also continue to work on the development and production of COVID-19 vaccines in Japan through a public-private partnership and intend to deliver them to the world in the future. Under this new strategy, Japan will also strengthen research and development of innovative vaccines, as well as work on improving the clinical trial environment, including through capacity building support, in order to prepare for future pandemics. In addition, we will continue to support the delivery of vaccines down to the last person through Japan's last 1 mile support, including improving cold chains, leveraging our strength we have gained through our experiences in health and medical-related assistance. Through such multi-layered cooperation, we will contribute to accelerating equitable access to safe and effective vaccines, catering to the needs of the world, including developing countries in particular. Excellencies, distinguished guests, ladies and gentlemen, the lofty goal of delivering 1.8 billion doses for nearly 30% of the population of AMC-eligible economies cannot be met by one country alone. I hope to see the circle of cooperation grow as proof of international solidarity. Thank you very much for your attention.
Thank you, Prime Minister Suga. Now, I'd like to open the floor to statements from other countries. First, I will invite President Palmeran of the Swiss Confederation, followed by Prime Minister Morrison of Australia and President Sanchez of Spain. President Palmeran, you have the floor.
Excellencies, ladies and gentlemen, 1 year ago, a few months into the global pandemic, we came together to support the development of safe and effective vaccines to be available worldwide. This investment in multilateral cooperation in science and in innovation has achieved unprecedented progress. However, setbacks caused by emerging variants are a constant reminder that we must act faster. Since the beginning of the crisis, Switzerland has been committed to finding global solutions for a rapid, affordable, and equitable access to COVID-19 vaccines diagnostics, and medicines. Switzerland was among the early contributors to the ACT Accelerator, including for the launch of the COVAX Advanced Market Commitment, AMC. It is my pleasure to announce that as part of the Swiss Federal Council's recent decision to contribute an additional $330 million to the ACT Accelerator, Switzerland will dedicate almost $140 million to the COVAX AMC. Further $20 million have been allocated to the International Organization for Migration, UNICEF, and the International Federation of Red Cross and Red Crescent Societies to support the distribution of vaccines, tests, and treatments so as to make sure that we also reach people in crisis zones and remote areas. Switzerland will continue engaging through multilateral cooperation to control the pandemic as soon as possible and to improve preparedness for future health crises.
G'day everyone from here in Australia. It's wonderful to join with you, and I thank my very good friend, Prime Minister Suga and Gavi, for convening this important summit. Well done, Yoshi. Over the past 18 months, the world has faced the most profound health and economic crisis in generations. This is a global pandemic. It doesn't know politics, it doesn't know borders, and none of us will be truly safe until all of us are safe. So our highest priority must be to ensure that everyone, no matter who they are or where they live, can receive a safe, effective and affordable vaccine. We understand this in Australia. That's why we strongly support the COVAX AMC. Last August, we pledged $80 million Australian to support its work delivering vaccines, which includes right here in our region. And today I'm delighted to announce a further $50 million contribution, bringing Australia's total support to $100 million. This will expand vaccine access for high-risk populations in lower and lower middle-income countries, including in our Southwest Pacific family and across Southeast Asia. And in my direct discussions with the leaders of those nations, they are indeed very appreciative of the work that COVAX has done to support their peoples in a time of great need. As well as our COVAX AMC commitments, we're investing $623 million Australian dollars to provide vaccine doses, technical advice, training for health workers, cold chain support to support countries across the Pacific and Southeast Asia. And this includes the $100 million support we have provided through our Quad partnership with Japan, the United States and India to develop 1 billion doses to Southeast Asia by 2022. And we've already distributed more than 125,000 Australian manufactured doses to our Pacific family and Timor-Leste, with many, many more to come. Of course, there's so much more to do. This global vaccine rollout is the largest in human history. It's possible only because of the dedication and professionalism of health and frontline workers around the world, and they have our deepest thanks and appreciation. Over coming months, these workers will be tested like never before, and we will strive to ensure that vaccine doses reach the world's most vulnerable people. Here in Australia, we're very proud to be playing our part, and we're especially proud to be doing it with our many, many friends around the world. But we're very proud to be especially working together with our great friends in Japan. And I want to thank again Prime Minister Suga for his leadership in this area.
Spain was among the countries supporting the creation of the ACT Accelerator back in April 2020. We're part of its facilitation council, and we have made financial contributions to support the vaccines pillar. My government saw clearly from the beginning of the crisis that we will only be safe from the virus when everyone in the planet is safe. The fight against the virus is not only about giving money, but also about proposing new ideas. My government has contributed with national projects that were pioneering, such as our initiative Vacunas Solidarias back in January this year. We have also supported very strongly the adoption by Europe as fast as possible of the EU vaccine sharing mechanism with several letters to the European Union institutions. A few weeks ago, we presented another international initiative, Vaccines for All, aiming at more flexible intellectual property rights, increased production and a broader distribution of vaccines. My country already committed to donate 7.5 million vaccines through COVAX to Latin American countries. Today, I would like to make some new announcements. First, that we will be committing another 15 million vaccines through COVAX, bringing the total to 22.5 million vaccines by the end of 2021. Additionally, Spain will provide another 50 million euros to COVAX through Gavi. Altogether, these contributions would make today a new total amount of more than 180 million euros that Spain will commit to the international efforts to fight COVID-19. Furthermore, the Spanish National Research Council is working with the CTAP, the WHO initiative launched a year ago by Costa Rica in order to grant an open license for a new diagnostic test. Only leading by the example, we will be effective in preaching solidarity. And only with solidarity can we overcome this crisis and heal the wounds in our societies. Thank you all for helping make it possible.
Gracias. Thank you, President Palmeram, Prime Minister Morrison, and President Sanchez. Next, I will welcome Prime Minister Löfven of Sweden, followed by Chancellor Kurz of Austria, and Prime Minister Jacobus Dutio of Iceland. President Löfven, the floor is yours.
Excellencies, ladies and gentlemen, thank you, Gavi, and thank you, Japan, for hosting today's summit. The goal is clear. We need global access to safe and effective COVID-19 vaccines, and we need it now. I believe the path toward that goal is clear as well. We need dollars and doses, but there is a third D, delivery. Vaccine delivery has started in almost all countries of the world. Thousands of health workers, scientists, public health staff, and many others are working tirelessly to deliver the largest mass vaccination campaign in the history of vaccines. I sincerely want to thank you. Without you, none of this would be possible. Together, we must fully fund COVAX. I am proud of Sweden's contribution of over $280 million, making us the largest contributor per capita. And I commend others who are contributing. Together, we must urgently share doses. Team Europe has committed to sharing at least 100 million doses this year, and I'm proud to announce that Sweden plans to contribute by increasing our previous donation commitment to a total of at least 3 million unearmarked doses to COVAX in 2021, including AstraZeneca, Johnson & Johnson, and Pfizer-BioNTech vaccines. With dollars, doses, and delivery, we can achieve global vaccine access. And together, we must succeed. Thank you.
Excellencies, ladies and gentlemen, when tackling the COVID-19 pandemic, one thing is clear. No one is safe until everyone is safe. The need for global solidarity and international cooperation has never been greater. Ever since the beginning of the crisis, COVAX has played a crucial role in securing global access to vaccines. Let me take this opportunity to thank everyone involved for their efforts in making this ambition a reality. Austria is committed to a joint and global approach in overcoming this crisis, and we will continue to show our solidarity. This is why I'm particularly proud today to announce that Austria will donate another 2.6 million euros to COVAX AMC, bringing our total contribution to 5 million euros. Ladies and gentlemen, the virus knows no borders. It is more important than ever to work together, trust in science and research, and help those in need. Austria stands ready to contribute to this global endeavor. Thank you for our good cooperation.
Dear colleagues, the COVID-19 global pandemic has been a steep learning curve for all of us. These have been trying times and so many lives have been lost. While going through the losses and difficulties, we also experienced some of the best qualities of our societies: cooperation, solidarity, empathy, and scientific brilliance. When the international community shares resources, knowledge, and ideas, we all benefit. The ACT Accelerator has played a key role in the development of COVID-19 tools, including securing over 2 billion doses of vaccines. In facing a global pandemic, we cannot exclude and neglect certain groups of people when it comes to vaccinations. Every country must do their share in correcting the imbalance in the access to COVID-19 vaccines, tests, and treatments. Closing the funding gap of the ACT Accelerator is key to the continued global efforts in guaranteeing fair and equitable access to vaccines for everyone. As women and girls continue to suffer disproportionately throughout the pandemic, gender equality must be ensured during the vaccine rollout. We must always make it our mission to safeguard the fundamental human rights of women and girls. In line with the objective of the ACT Accelerator, I am pleased to announce that Iceland will contribute 500 million Icelandic kronas, or 3.4 million euros, to COVAX AMC in 2021. This brings Iceland's total contribution to COVAX to over 1 billion Icelandic kronas. We have good reason to be optimistic about the future. The pandemic has illustrated the interconnectedness of the world and the importance of a healthy planet and shared responsibility. We need to make sure that every person worldwide has a chance of a good life and is supported and cared for. This is evident now, perhaps more evident than ever. Thank you all.
Thank you, Prime Minister Ruben, Chancellor Kurz, and Prime Minister Jacobus Duttero. Now, I will invite Prime Minister Ducrot of Belgium, followed by Prime Minister Kim Bouillon of the Republic of Korea, and Prime Minister Berkley of Luxembourg. Prime Minister Ducrot, the floor is yours.
Ladies and gentlemen, the only way we will beat this pandemic is by acting together as one worldwide community of people. That is why COVAX is vital, to bring a halt to the circulation of the virus, to stop it from mutating and developing new variants that might threaten people everywhere, vaccinated or not. That is why Belgium will donate 4 million vaccine doses to countries outside Europe, countries in Africa, in the Western Balkan, in our eastern and southern neighborhood, to make sure that Europe is not a vaccine island, but a vaccine hub, an engine behind a worldwide vaccination campaign. That is the plan for 2021, but we must look beyond this year. We must make this international solidarity more structural by increasing the global production capacity for vaccines, so that for this and all future pandemics, there will be no longer countries that get served first and others who have to wait in line. That requires a concerted effort, global cooperation. Cooperation as we have seen today, but at a much bigger scale. Cooperation between countries, but also between public and private sector. Of skills and knowledge, transfer of people who know how to develop, but also how to produce vaccines to countries in need. We have to organize this exchange, this transfer in such a way that economic risk-taking is still rewarded fairly. Because it is thanks to risk-taking that we got the vaccines in the first place. The goal is to strike a new balance, a new equilibrium that ensures we all move forward together. To lift global health standards so everyone gets access to good healthcare. So thank you for organizing this summit. I wish you a productive meeting because I truly believe that COVAX has the possibility to grow into something much bigger, something that will benefit the world.
각국의 정상과 국제기구 대표자 여러분 반갑습니다. 코백스 AMC 정상회의에 함께 하게 되어 매우 기쁘게 생각합니다. 우선 이번 회의를 주최한 일본국과 가비 그리고 코백스 AMC에 참여하고 있는 모든 국가의 협력에 감사의 말씀을 전합니다. 코로나19 팬데믹이 시작한 지 1년이 훨씬 넘었습니다. 그동안 인류의 생활 방식이 많이 바뀌었고 국가와 국가, 사람과 사람의 물리적 거리도 멀어졌습니다. 그러나 역설적으로 우리는 하나로 연결된 세계에 살고 있다는 것을 다시금 실감하고 있습니다. 코로나19 극복을 위해서는 무엇보다도 국제사회의 연대와 협력이 중요합니다. 한국은 이를 위해서 다작한 협력을 적극 추진해 왔습니다. 확산 초기부터 코로나19 대응 ODA 추진 전략을 수립하였고 120여 개국에 6억 불 상당의 방역물자와 긴급 재난 차원을 제공했습니다. 보건취약국들이 실질적인 대응 역량을 제고할 수 있도록 수원국 맞춤형으로 방역 경험도 공유했습니다. 코로나19 극복을 위해서는 백신에 대한 공평한 접근이 무엇보다도 중요합니다. 안전성과 효과성이 검증된 백신을 충분히 생산하고 생산된 백신을 보건취약국을 포함한 전 세계에 신속하게 공급되어야 할 것입니다. 이를 위해서 한국은 코백스 AMC에 대한 작년의 노력에 더하여 획기적인 기업 확대를 추가로 발표할 것입니다. 한국은 세계 최고 수준의 바이오 역량을 보유하고 있습니다. 아스트라제네카, 노바백스, 스푸트니크5 등 다양한 백신을 위탁 생산하고 있고 주요 국가 및 기업과도 긴밀하게 협력하고 있습니다. 이런 바이오 역량을 토대로 한국은 새로운 글로벌 백신 허브로서의 제 역할을 다해 국제사회의 코로나19 극복에 기여하겠습니다. 각국 정상과 국제기구 대표자 여러분, 감염병 위기는 앞으로도 언제든지 찾아올 수 있습니다. 우리 인류는 보건 분야에서의 국제 협력을 강화, 미래 감염병 대응 역량을 획기적으로 높여야 합니다. 이번 코백스, AMC 등 국제 협력을 통해서 전 세계가 하루빨리 일상으로 복귀하고 더 나은 미래로 나아갈 수 있기를 기대합니다. 이번 회의를 주최해 주신 일본 국가 스가 총리님 그리고 가비 관계자 여러분께 다시 한번 깊은 감사의 말씀을 드립니다. 감사합니다.
Dear colleagues, it's my great pleasure to join you at this very important COVAX summit, One World Protected. Almost exactly a year ago, the global community came together for the Global Vaccine Summit that led to the creation of COVAX, the first global vaccine procurement mechanism of this scale in order to enable equitable access to COVID-19 vaccine doses worldwide. 1 year later, the urgent need for increased solidarity and strengthened collaboration with all stakeholders remains more important than ever. Life-saving COVID-19 vaccines were created and delivered in record time. However, the distribution of vaccines to overcome the virus remains too slow for low and middle-income countries. Despite having made substantive progress in preventing and treating the disease, the terrible images from too many parts of the world reminds us that the fight against COVID-19 and its variants is far from over. It is simple. In order to fight the pandemic effectively, vaccine doses need to go where they are needed the most. Under the flagship of Team Europe, we have a decisive role to play to support COVAX, to assist communities in the world's poorest countries to access vaccines, in particular in Africa. As the pandemic has exacerbated inequalities and increased the vulnerability of certain population groups, we need to respond promptly, effectively, and sustainably, and in order to leave no one behind. Ladies and gentlemen, if the COVID-19 pandemic has taught us one thing, it is that investing in global health is paramount because no one is safe until everyone is safe. That is why I'm pleased to announce that our government, the government of Luxembourg, will double its contribution to the COVAX pillar with an additional €1 million. We will continue working together in order to find sustainable solutions and ensure equitable access to vaccines.
Thank you, Prime Minister Ducrot, Prime Minister Kim, and Prime Minister Berkley. Next, I will receive President Duterte of the Philippines, followed by Prime Minister Jagannath of Mauritius. President Duterte, you have the floor.
Prime Minister Suga, distinguished delegates, Mr. Barroso, Mr. Berkley of Gavi, the Vaccine Alliance, Excellencies. The COVID-19 pandemic will only end once everyone has access to safe and effective vaccine. But to this day, access has not been universal. More than 82% of the vaccines have gone to the rich countries, while only less than 1% have gone to the low-income countries. This imbalance must be corrected, or there will be no real and inclusive global recovery to speak of. As both donor and recipient country, the Philippines counts on the COVAX AMC initiative to bring much-needed vaccines to developing countries. It is our moral responsibility to help each other and face this crisis with greater solidarity and urgency. Today, I am pleased to announce that as COVAX partner, the Philippines commits an additional of $1 million. While our modest contribution demonstrates our firm commitment to this global fight against COVID-19, it is our hope that many more countries will contribute. After this will be our collective investment for the world's people. We thank the Gavi Alliance and assure you of our unwavering support. Thank you.
Excellencies, allow me to extend warm greetings from the Republic of Mauritius. I wish to thank the organizers, in particular, the Prime Minister of Japan, His Excellency, Mr. Suga Yoshihide, for inviting Mauritius to participate in this summit. The COVID-19 pandemic has reminded us, once again, of the need for international cooperation and global solidarity to tackle any pandemic or global health emergency. Equitable and timely access to vaccines and medicines is an important part of the solution, especially for small island developing states like Mauritius, whose economies have suffered significantly. No country should be left behind to fend for itself. It is in this spirit that Mauritius made a contribution of $2,500 in June 2020 as a gesture of goodwill to support Gavi. I am pleased to pledge the same amount this time also to assist Gavi's endeavor to ensure universal access to the vaccines. Aware that an increased vaccine production will lead to a reduction in the costs of vaccines, Mauritius joins other developing countries to support the TRIPS IP waiver proposal tabled by India and South Africa at the World Trade Organization. This proposal is a glimmer of hope for billions of people around the world. I thank you for your attention.
Mabuti. Yes, thank you, President Duterte and Prime Minister Jagrat. Now, I welcome Mr. Seth, Managing Director of Bill and Melinda Gates Foundations. Mr. Seth, the floor is yours.
Thank you, Minister Motegi, and greetings to everyone. I'm very happy to join you today. Bill spoke earlier about the critical efforts of so many who have created and delivered to the world a safe and effective set of COVID-19 vaccines, and it's certainly something to celebrate. To build on his remarks, I'm very pleased to announce that the Bill and Melinda Gates Foundation is pledging an additional $50 million to Gavi, the Vaccine Alliance. The pledge will support COVID-19 vaccine purchasing through Gavi's COVAX AMC, as well as delivery of these vaccines to 92 lower-income countries. I would like to express my sincere gratitude to Japan for hosting this successful event, as well as to all those who have pledged. Thank you so much for your generosity. And thank you for ensuring that the COVAX AMC has the resources it needs to deliver on its promise.
Thank you, Mr. Seth, for your remarks and commitment. Thank you very much for the strong commitment by AMC donors. We are making good progress in reaching our goal of $8.3 billion. We'll have another pledging session later, but before that, we'll have the session on partnership with the private sector. Ms. Kimani will moderate the next session.
Well, it's a pleasure to be joining you all again to show how the private sector has been making a difference. Now, working with the private sector is really part of Gavi's DNA. And so building on this track record, Gavi is now partnering with corporations and foundations to bring that same resolve, commitment, and also expertise to COVAX AMC. And as you've seen, this pandemic has not only disrupted lives, but also livelihoods of millions around the world. The urgent need for vaccine equity is not only a moral issue, but an economic one. The private sector understands that the COVAX AMC represents the largest immunization campaign ever, and that it has a critical role to play in this global effort. So we're excited to highlight a few of the partners that are joining the COVAX AMC and the global effort to ensure vaccine equity. First up is Toyota Tsusho, a trading company of the Toyota Group. They joined COVAX with a contribution of 100 million Japanese yen and a partnership with Power to make transformational changes in vaccine delivery. Thank you, Toyota Tsusho. We're very excited about the potential of this partnership to safely deliver vaccines to the last mile. Now, it's my great pleasure to introduce Phyllis Costanza, CEO of UBS Optimus Foundation, who will talk about the power of a global network of philanthropists who actually stepped up to support communities wherever they are. The campaign starts with $1.5 million, and we're excited to see it grow and expand in the coming months.
Thank you, Prime Minister Suga, Mr. Barroso, distinguished speakers and guests. What an honor to be able to share a few thoughts at this impressive event. I speak on behalf of myself and UBS when I say we are thrilled for this partnership to be taking place with such a leader like Gavi to support COVAX. As Seth recently stated in our launch webinar, vaccines are the most powerful tool that exists right now, and we couldn't agree more. In many ways, 2020 was a year of reckoning. Healthcare gaps, access to education, ongoing racial injustices, and other issues exposing inequality were all magnified by the pandemic. Because we hold a responsibility to our stakeholders, who are not just our clients and investors, but also colleagues and the communities in which we live and do business, we have a duty to focus our impact on creating positive change. And we could do this most effectively with a partnership like this one with Gavi to secure more funding for COVAX. Together with our clients, the UBS Optimus Foundation will contribute at least $1.5 million, and we're optimistic that the final outcome of this campaign will surpass that. Our partnership and support of COVAX has the power to not only alleviate immediate health crises in places like India and to prevent future outbreaks around the world, but to also help bring equality in healthcare to the forefront. The pandemic is a global challenge that requires a global response, and we're proud to be part of the solution. Thank you.
Well, thank you, Phyllis, and UPS Optimus Foundation for this commitment. Moving from power of networks to the power of cloud-based technology, our next speaker is Erin Riley, Chief Impact Officer of Twilio. Now, we're excited to announce that Twilio will be joining the COVAX AMC with a pledge of $10 million, highlighting their commitment to vaccine equity.
Hi, I'm honored to be here with you today because all of you are the ones building the path to global access to vaccines. Over the last 2 years, we have all felt fear, uncertainty, sometimes loneliness and loss due to COVID-19. But even in these lowest moments, we've been really inspired by the people who rise together to stop this pandemic. I'm Erin, and I work at Twilio. And in case you're not familiar with Twilio, we're a cloud communications company. We power text, video, voice, email, WhatsApp for most of the services you use every day. And there are 3 reasons that Twilio is really committed to supporting Gavi and the COVAX initiative. The first is that COVID-19 is a global challenge that needs a global response. To stop COVID-19, everyone needs access to vaccinations. But today, vaccines are not available for most of the world's population. So to solve this problem, we all need to step up and give. The second reason is that COVAX is really a remarkable collaboration across the public and private sectors. We're all coming together as this diverse coalition who are dedicated to public health. In fact, COVAX is really a milestone showing how the public and private sector can join forces to support public health and health equity. The third reason we're excited to support Gavi and the COVAX initiative is that the right communication at the right time is truly essential to ending this pandemic. At Twilio, we have seen people use communications technology to solve some of the world's toughest problems, like Save the Children, who are using chatbots and WhatsApp to combat vaccine misinformation. We're working with hundreds of public agencies, NGOs, and health organizations, helping them use communications to provide information, resources, and support to distribute vaccines. We provide access to technology, grant funding, and employee volunteering. Many of you know firsthand that we all have a lot of hard work ahead of us. That's why we're here with you. We're working with all the members of the COVAX Coalition so that together we can help everyone around the world have equitable access to vaccines.
Thank you again, Twilio, and thank you all for your generous contributions. Now, with today's announcements, I'm pleased to say that in just a year, the COVAX AMC has attracted over $300 million from private sector. So rounding off this session, it's my honor to give the floor back to Minister Motegi.
Thank you very much for excellent presentations by three partners. The COVAX facility is supported by not only countries and international organizations, but also generous donors and partners of the private sector and civil society. The role of such partners is essential for achieving equitable access to vaccines. Japan is committed to providing last one-mile support by delivering vaccines to immunization sites in each country. In a way that is complementary to the COVAX facility, which procures and allocates vaccines. For example, Japan's refrigerated vehicles introduced in this session can reliably deliver vaccines to areas where it is difficult to transport vaccines due to extreme heat or remote locations. We have high hopes that partners in wide-ranging fields in healthcare and other sectors will collaborate with the COVAX facility so that vaccination effort will be most effective. Thank you very much. Let us move on to the second pledging sessions. We are on time so far. Now, it's my pleasure to introduce Minister Gould, Minister of the International Development of Canada. Mr. Gould, over to you. Excuse me, Minister.
Thank you so much, Minister. It's a pleasure to join you today from Canada for the COVAX AMC Summit. Let me start by thanking our host, Japan, and the COVAX facility for organizing this important event. This has been a time of tragedy, but also one of collaboration, scientific achievement, and most recently, of hope. With multiple vaccines now approved for use and more doses administered every day, we know we can protect people from the spread of COVID-19. These vaccines are our best exit strategy from this pandemic, but the world also needs access to them. Borders shouldn't be barriers to the best and latest science. That's why Canada supports equitable access around the globe to COVID-19 vaccines, therapeutics, and diagnostics. We are working hand in hand with the leads of the ACT Accelerator and the COVAX facility. As a major contributor to the ACT Accelerator, we have committed more than $1.3 billion to date. And with dedicated funding from Canada, COVAX has developed a way to easily and swiftly share surplus vaccine doses. Today, we are focusing support for the 92 AMC economies. While vaccinating 20% of each economy's population will protect the most vulnerable, the work does not and cannot stop there. We must aim to reach everyone in low and lower middle income countries. To do this, we have to support the procurement of COVID-19 vaccines. That is why I am pleased to announce that Canada is doubling its initial contribution to the COVAX AMC with an additional pledge of 220 million Canadian dollars. As a COVAX AMC co-chair, I also commit to doing all that I can to ensure the facility's success and that you can count on Canada's ongoing support. We urge all countries with the means to do so to support the COVAX facility and the AMC in any way that they can. Only by pulling together will we protect everyone, everywhere. Thank you.
Thank you, Merci, Minister Gould, for joining us today. Next, I will invite Minister Lemoine, Minister of Tourism, French National Border, and Francophonie of France, followed by Foreign Minister Zabaha of Kuwait and Foreign Minister Meritz of Estonia. Mr. Lemoine, the floor is yours.
Monsieur le Premier Ministre, Prime Minister, ladies and gentlemen, we must step up our efforts so that the vaccine is truly a global public good. The first deliveries of doses by COVAX to low and middle-income countries is a decisive step forward, 72 million in 3 months. France is proud to have contributed alongside Team Europe from the outset to the COVAX facility and its action in support of fragile country. And this is, of course, a moral imperative, but also the only way to end this pandemic together. And as the President of the Republic, Emmanuel Macron, announced it during the Health Summit in May, France will increase its support to COVAX in 2 ways. First, by increasing its vaccine donations. As a pioneer in the field, France began to implement this commitment in April and will donate 30 million doses of several vaccines to COVAX in 2021. More countries are expected to join the process as of today. So we must donate the largest possible volume of vaccines as of now via COVAX based on a diversified vaccine portfolio. Secondly, of the 500 million euros announced by President Macron for Act A, we are going to double our financial contribution to COVAX with an additional 100 million euros for low and middle-income countries. This amount will help purchase vaccines to reach the objective of vaccinating 30% of the population in these countries, supply the humanitarian buffer, and cover ancillary costs related to the donation of doses. To conclude, we must further boost our efficiency on the ground. Firstly, through regular monitoring of the smooth running of the vaccination programs and by establishing a specific performance framework, strengthening health systems and the involvement of all stakeholders, which are key components of successful vaccination campaigns. Secondly, through the development of production partnerships and technology transfers, including in Africa, to significantly increase global production. We believe that the involvement of the WHO and the WTO on top of the initiatives led by COVAX will be a decisive factor. Thank you very much, and see you soon.
Bismillah ar-Rahman. In the name of God, the most merciful and the most compassionate, Your Excellency, Mr. Yoshihide Suga, Prime Minister of Japan, distinguished delegates, a very good morning to all of you, and may peace be upon you all. At the outset, I'm honored and delighted to convey to you the greetings of His Highness the Emir of State of Kuwait, Sheikh Nawal Al-Ahmed Al-Jabr Al-Sabah, may God preserve him, to the conference and all those who have worked together to make this summit a reality, and the aim of which is to achieve its goals in a way that serves international humanitarian work. distinguished delegates, since the outbreak and spread of the COVID-19, the global epidemic remains one of the biggest and the thorniest global challenge, which requires the international community to come together, cooperate, intensify efforts, and work so that we support Gavi Alliance and we make the COVAX facility a success to ensure fair, fast, and equitable access to the vaccines for everyone. Excellencies, the total contribution of Kuwait has reached $287.4 million in order to support an international coverage of security. And based on the guidance of His Highness the Emir Sheikh Nawaf Al-Ahmed Al-Jabar Al-Sabah, we announced a commitment from the state of Kuwait to Gavi Alliance to boost the COVAX initiative with an additional $40 million. Thank you very much.
Allow me to thank Japan for hosting the virtual summit to accelerate access to COVID-19 vaccines for lower-income countries. More than a year has passed since the World Health Organization declared COVID-19 as pandemic. New and more transmissible variants of the virus may prolong this health crisis longer than expected. We all know that fully restoring international trade, travel, prosperity and security is only possible when COVID-19 is under control everywhere. We must make sure that no one is left behind. Equal access to vaccines should not remain empty words. We need efforts to globally accelerate the availability of raw materials, facilitate agreements between manufacturers across supply chains, scale up production, and further research and development efforts. The ACT Accelerator and its vaccine pillar, the COVAX facility, have been instrumental in these global efforts, and we have a shared responsibility to make them succeed. Estonia remains committed to equal and fair distribution of vaccines globally. We made our first contribution to Gavi and the COVAX AMC at the end of 2020. Today, I am happy to announce an additional pledge of €70,000 for 2021 to support the COVAX facility and equitable global access to COVID-19 vaccines. In addition, we recognize that donating vaccine doses is similarly important to guarantee rapid access to COVID-19 vaccines for all. Therefore, the government of Estonia is exploring ways to possibly contribute to the COVAX facility by donating 400,000 doses of vaccines. I thank you and wish you all a successful summit.
Merci. Shukran. Thank you. Mr. Rumwan, Minister Zahaba, and Minister Meritz. Next, I will welcome Foreign Minister Ebrard of Mexico, followed by Foreign Minister Hasra of Liechtenstein, and Foreign Minister Bartolo of Malta. Minister Ebrard, over to you.
Muy buenos días a todas y a todos los distinguidos participantes en este evento. Quiero en primer lugar agradecer.
Thank you to all the participants to this event. First of all, at the outset, I would like to congratulate the government of Japan and Gavi for this initiative that aims to strengthen the role designed for COVAX through the Advanced Market Commitment, which is a way to help COVAX fulfill its missions faster. Its mission is to bring us closer to an equitable distribution of vaccines around the world as soon as possible. That is not the situation today as we planned when COVAX was launched as an initiative. But that is not due to the facility, but rather to the fact that various vaccine manufacturers have not been able to deliver, either because of technical reasons or because some countries have prioritized their own domestic market over exports. We need to see ourselves as a single community rather than as individual countries with our own national interest. What is at stake here is seeing how far we can go in achieving common goals through multilateral mechanisms such as COVAX. We, Mexico, have participated from the beginning, and we will definitely continue to do so. We strongly believe that it is the best possible solution that is that it is fair and has an essential ethical dimension that has to do with the dignity of the human being, it has also a dimension of mutual security, which is this: if we do not make sure that all countries get access to vaccines quickly, we will be at equal risk. So it is both an ethical issue and a security issue. And in circumstances such as this, we were where there is such level of need, so many lives involved, if we cannot ensure that a multilateral mechanism can guarantee access for all, as I said, to vaccines, then we are in a very difficult situation, and we would urgently need to change that reality. So that is why we think COVAX is the way forward. Mexico is going to donate $250,000 for now to this initiative. Now we will also be contributing so that COVAX can make swifter progress and has greater global coverage. Thank you for inviting us. It is a pleasure to be part of this initiative. And once again, we extend thanks to the government of Japan and to Gavi for their interest in ensuring prompt, rapid, and effective multilateral access to COVID-19 vaccines. Thank you. Muchísimas gracias, presidente. Quiero encomiar al CAM y a Japón por
welcomes the unified message of solidarity and cooperation sent by the international community in its response to the COVID-19 crisis. Since the outbreak of the crisis, Liechtenstein has provided more than 1.6 million Swiss francs in emergency relief and development assistance. As a reaction to the increased global needs, Liechtenstein has increased its budget for international solidarity by almost 5%. Ensuring equal access to vaccination is a part of our activities. I am happy to pledge that Liechtenstein will yet again contribute 100,000 Swiss francs to the COVAX AMC. We see COVAX as a prime example of a global public-private partnership. Everyone can play its part to ensure that access to a vaccine does not become a global barometer of inequality. I thank you.
Yoshihide Suga, Your Excellency Jose Manuel Barroso, Excellencies, colleagues, ladies and gentlemen. I am honored to represent the government of Malta on this very important occasion. And at the outset, I would like to thank most particularly the government of Japan and Gavi for co-hosting this very timely summit of critical importance. The significance of 93% of advanced market commitment eligible countries that have requested more vaccines from COVAX than it can supply this year instigates the need for international coordination in tackling the COVID-19 pandemic and achieve universal health coverage. As the virus and its variants continue to spread, we do not have the luxury of time. We urgently need to see one world protected. This can only be accomplished by further raising vaccination rates, further diversifying our vaccine portfolio, and preparing to fight variants. Cognizant of the urgent need faced by struggling countries around the world for access to COVID-19 vaccines, I am pleased to announce that Malta hereby commits itself to contributing to EU efforts to ensure that COVAX has the necessary financial and medical resources to lead the fight against the pandemic. I would like to place on record my government's praise for the efforts of Gavi and COVAX in ensuring that people in all countries get rapid, fair, and equitable access to vaccines, including through organizing this advanced marketing commitment meeting. Thank you.
nobody is safe until everybody is safe. Thank you, Minister Abraham, Minister Hasra, and Minister Bartolo. Next, I will invite Minister Skinnari, Minister for International Development of Finland, followed by Minister Saidi, Minister of Health of Oman. Mr. Skinnari, the floor is yours.
Excellencies, dear friends of Gavi, COVAX, AMC, multilateral cooperation and global solidarity are essential for ending the pandemic. We've seen tremendous progress in COVID-19 vaccine development. We must make sure that they are equally distributed, leaving no one's health behind. This is where the role of Gavi, COVAX, AMC mechanism becomes critical. I want to take this opportunity to recognize that without the flexible, cross-sectoral and dynamic collaboration of donors, international organizations, and the private sector, this would not have been possible. This partnership must continue to overcome the challenges that we still face. Finland is pleased to announce its intention to support Gavi COVAX AMC mechanism this year with 10 million euros. We will follow the situation closely, and our aim is to continue supporting Gavi in 2022 as well. In addition, further financing of 10 million euros is planned for 2021. This is subject to the parliamentary approval. This is earmarked support tied to vaccines procured by Finland as part of the EU vaccine purchases. Finland looks forward to the prosperous cooperation with COVAX AMC. Thank you so much.
Your Excellency, Mr. Yoshihide Suga, the Prime Minister of Japan, Your Excellencies, ladies and gentlemen. On behalf of His Majesty Sultan Haytham bin Tariq Al Said, I would like to thank you for giving us the opportunity to speak today on this noble cause. In Oman, we believe that international solidarity is not merely a goal to aspire, but rather a duty. This is especially important in the field of health, because health does not recognize borders or socioeconomics. Unfortunately, until we address the growing inequalities, many future generations will be born into a context of inadequate health care for no fault of their own, while individuals in developed countries enjoy access to world-class services. We applaud Gavi for its tireless efforts in making the world literally more livable for millions of people, despite the innumerable challenges it faces and continues to face due to the pandemic. COVAX has demonstrated its ability to harbor solidarity and to start a movement toward more equal global distribution of vaccines. Needless to say, there are many aspects that can be improved, but that is not a criticism. On the contrary, COVAX needs to receive more support in order to address our shortcomings, because despite the inadequate funds, COVAX continued to deliver. And in light of this, I'm delighted to inform you that Oman pledges $1 million to the advanced market commitment. We are confident that by having each of us play a part, we can save many lives and make the world a better place. I urge all donors to contribute, because no matter how small the contribution is, it makes a difference. Thank you very much.
Shukran. Thank you, Minister Skinnari and Minister Saidi. Next, I will welcome Minister Speranza, Minister of Health of Italy, and then Minister Montensen, Minister for Development Cooperation of Ireland. Minister Speranza, over to you.
Dear Prime Minister Suga, Excellencies, it's a pleasure for me to give this statement on behalf of the Italian government at this Gavi COVAX AMC summit. Let me thank, first of all, the government of Japan and Gavi for organizing these very important events in a crucial moment for our world. On May 21st, together with the European Commission, Italy hosted the Global Health Summit within our G20 presidency. The summit adopted the Roma Declaration, a set of principles to guide our joint actions in pandemic prevention, preparedness and response. The summit also provided the occasion to make new pledges to our common efforts to fight the COVID-19 pandemic. Italy announced an additional contribution of 300 million euros to the COVAX facility and the donation of 15 million doses of vaccines. Other countries made similar announcements. Pharmaceutical companies announced their intention to provide 1.3 billion doses at production cost. We believe the Global Health Summit marked a turning point in dose sharing, which is at the moment our most urgent priority. We must also look into ways to expand vaccine production capacity globally. We should aim to make local supply meet local demand, especially in Africa, right now suffering from a shortage of vaccines. In order to achieve this, we must bring together governments, international organizations and the private sector. The summit in Roma reaffirmed the principles of equitable distribution of vaccines, but also of therapeutics and diagnostics, which must remain our guiding principles. This is a moral imperative and the only way to prevent the emergence of new variants that might occur vaccines less effective. At the Global Health Summit, we reaffirmed our commitment to strengthening the multilateral health architecture and our support to the Access to COVID-19 Tools Accelerator. Act A should be fully financed if we want to finally defeat the pandemic. This is why we appeal to all countries in a position to do so to contribute funds to Gavi AMC within Act A to accelerate access to 1.8 billion vaccine doses for lower-income economies. I would finally like to praise Gavi's role in fighting the COVID-19 pandemic and more in general in carrying out vaccination campaigns that saved 14 million of lives. Italy is traditionally one of the main financial contributors to Gavi and stands ready to cooperate further to the benefit of the global health. Thank you very much.
Dear friends, thanks to Prime Minister of Japan and to Gavi for bringing us together today. COVAX has made important progress and now supplies vaccines to countries all over the world. Nevertheless, the global access to vaccines is still unbalanced. It is still unfair. International and collective actions is required to finance and secure the doses needed. I'm happy to announce that Denmark will donate 3 million vaccines in 2021. A substantial part will be donated through COVAX AMC. The donation complements our financial support to the global fight against the pandemic. We recently approved a new COVID-19 relief package of $65 million. It includes a second contribution to COVAX AMC. It also includes support to other partners to ensure necessary infrastructure as well as resources to distribute diagnostic, therapeutics and vaccines. We are also addressing the long-term perspective by supporting health systems in development countries to build resilience. In total, Denmark has contributed nearly $300 million in development assistance in 4 relief packages since the outbreak of the pandemic. On top of this, we have supported a number of countries with medical equipment and health personnel. Let me assure you that Denmark remains committed to protect the most fragile groups who suffer the most under the pandemic. We must leave no one behind. Thank you.
Grazie. Thank you. Minister Speranza of Italy and Minister Mortensen of Denmark. Now, it is my pleasure to give the floor to Minister Crowley, Minister of Health of Qatar, and Deputy Minister Jabłonski of Poland. Minister Crowley, please.
Your Excellencies, ladies and gentlemen, the State of Qatar is delighted to participate in today's One World Protected Global Alliance for Vaccines and Immunization Summit, which aims at strengthening international cooperation to secure the necessary funding for the COVID-19 vaccination program and accelerate access to effective and safe vaccines for lower income countries. We would like to thank the government of Japan and Gavi for co-hosting the significant virtual summit at this critical and opportune time. It has become clear that to put an end to this pandemic, we will require effective international solidarity and a shared responsibility. Your Excellencies, Qatar reaffirms its support for the COVAX facility to accelerate global access to COVID-19 vaccines and stresses the importance of adhering to the political declaration on COVID-19 vaccines to ensure that all countries have access to vaccines in a comprehensive, equitable, affordable, and timely manner. Since the beginning of the COVID-19 pandemic, Qatar provided medical aid to more than 80 countries significantly impacted by the health crisis throughout 2020. At the June 2020 COVID Global Vaccine Summit held in London, His Highness Sheikh Tamim bin Hamad Al Thani announced Qatar's allocation of $20 million to the Gavi. A co-contribution agreement has followed this announcement, in which $10 million is donated to the WHO to support WHO's 13th General Program of Work and the initiative of accelerating the access to COVID-19 tools in countries most in need. This donation makes Qatar one of only 4 countries that has donated unearmarked funds to the WHO, in line with recent recommendations for flexible donations. We also take pride in Qatar Red Crescent's initiative, in collaboration with the World Health Organization, which aims to allocate its charity donations to provide COVID-19 vaccines to refugees, displaced persons, and migrants around the world. This initiative was launched in April 2021 and will run for 3 years. Finally, we would like to highlight the prominent role Qatar Airways plays in transporting COVID-19 vaccines and other vital supplies to impacted regions and communities worldwide. In this regard, Qatar Airway Cargo has delivered well over 27 million COVID-19 vaccines as of early April 2021, including COVID-19 vaccines for UNICEF as part of a 5-year MOU to support UNICEF's humanitarian air flight initiatives. Ladies and gentlemen, to conclude, Qatar reaffirms its commitment to supporting the efforts of the international community to ensure all countries, including lower-income countries, have access and equitable access to COVID-19 vaccines. World health security requires joint international action to combat the health challenges that threaten us all. Let's indeed come together for one world protected, leaving no one behind. Thank you very much.
Dear Prime Minister Suga, dear Minister Motegi, Your Excellencies, ladies and gentlemen, all esteemed participants of this Gavi COVAX AMC Summit. First of all, I want to thank Japan and Gavi Alliance for organizing this very important event and express my hope that together we will be able to prevail and to defeat this pandemic. Since the beginning of it, Poland has been very actively engaged in all efforts aiming at fighting both the disease and its direct consequences, as well as countering the impact that we all feel in our societies and economies. Although Poland, as many other countries around the world, has been facing the situation of immense pressure to cope with the pandemic crisis, it has not weakened our determination to help those in greater need. Our efforts so far have surpassed total worth of 135 million euro. It includes both reorientation of Polish bilateral development assistance and support to multinational mechanisms, as well as humanitarian assistance and support to research and development in health sectors. Other efforts aimed to provide universal access for the anti-COVID drugs, tests, and vaccines on the basis of affordable price to all countries and people around the world. We are aware that despite our efforts, the world continues to face growing uncertainty due to an unprecedented health crisis with grave consequences and deteriorating economic conditions, especially in the most vulnerable countries of the international community. Poland declares its strong support for global initiatives and collaboration to accelerate a fair and equitable access to vaccines for everyone in the world. We see the COVAX initiative not only as a token of global solidarity and partnership, but also as the only effective way to end the pandemic, which as a global threat requires global actions. That is why I am pleased to announce that in addition to our national efforts, Poland has made a voluntary contribution in the amount of over 3.3 million zloty, that is a little less than $1 million, to the COVAX facility managed by the Gavi Alliance. This contribution is complementary to the support granted to COVAX facility by the European Union on behalf of its member states via Team Europe funding and guarantees. It is my strong belief that this contribution will be another step towards our joint victory over the pandemic, and I encourage other partners to join global efforts and to help countries in need in fighting this unprecedented crisis. Thank you all, and I wish you a successful summit.
Shukran. Thank you. Minister Arukori and Mr. Yabonsky for your remarks. Next, I will welcome Dr. Frakabat, Parliamentary Secretary, State Secretary for Economic Cooperation and Development of Germany, followed by Minister Labia, Minister of Health of Saudi Arabia, Minister Queiroga, Minister of Health of Brazil, and Minister Andrea of Portugal. Secretary Frakabat, the floor is yours.
Excellencies, ladies and gentlemen, from the beginning, Germany has been a committed partner in the global fight against the COVID-19 pandemic. Germany supports the ACT accelerator with a total of 2.2 billion euros as its second largest donor, of which 1.08 billion euros are provided to COVAX AMC. Through COVAX AMC, millions of doses have already been delivered to AMC countries. This multilateral mechanism has enabled the world to make important progress in the global fight against the pandemic. However, challenges remain with regard to equitable access to COVID-19 vaccines worldwide. We can confront these challenges by closing the funding gap of COVAX AMC, sharing vaccine doses, and supporting the local manufacturing of vaccines. COVAX AMC needs additional resources to lift vaccine coverage in the AMC countries up to 26% by the end of 2021. We therefore call on all partners to help fill the COVAX AMC funding gap today. Furthermore, dose sharing is important to ensure equitable access to COVID-19 vaccines worldwide. First countries already shared doses. Germany will follow. Chancellor Angela Merkel recently expressed that Germany will share 30 million vaccine doses. Besides funding and dose sharing, the local production of vaccines is of crucial importance if we want to meet the global demand and be better prepared for future pandemics. With the COVAX Manufacturing Task Force and the ACT-A Vaccine Manufacturing Working Group, important global initiatives are underway already. Germany, together with South Africa as co-chairs of the ACT-A Vaccine Manufacturing Working Group, are fully in support of these vital efforts. Concluding, I would like to thank the government of Japan for hosting this virtual event. The gathering today of public sector, private sector, civil society, and scientific community partners from all around the world speaks for itself. We can only fight the pandemic if we act all together. Thank you.
Your Excellencies, ladies and gentlemen, it gives me great pleasure to participate in this virtual Gavi COVAX AMC Summit. And I would like to extend our gratitude to the government of Japan for their tremendous efforts leading up to this successful event. I would also like to thank our hosts, the Japanese Prime Minister, His Excellency Suga Yoshihide, and Jose Manuel Barroso, Chair of the Gavi Board, as well as the CEO of Gavi, Seth Berkley, who has worked tirelessly in engaging various entities to partake in these efforts towards accelerating global recovery from this pandemic. At the onset of the pandemic, the Kingdom of Saudi Arabia has initiated an extraordinary leaders summit to identify gaps and to work collectively to help fill them in order to ensure that the world is equipped to fight this pandemic and to overcome its implications. The ACT Accelerator is the tool that can see us through this pandemic. Saudi Arabia has committed $500 million early on towards it, as we are certain that it is the most effective way in which all countries can receive equitable access to diagnostics, therapeutics, and vaccines. The COVAX facility has shipped over 77 million COVID-19 vaccines to 127 participants and needs our support to accelerate access to 1.8 billion vaccines doses for lower income countries. This event has engaged world leaders, the private sector, civil society, and key partners to reflect on the challenges and lessons learned throughout this pandemic. It is through solidarity and our support of organizations such as Gavi that we will be able to ensure that no one is left behind. We are extremely proud of the funds raised so far, and we are aware of the long road ahead of us. We are, however, confident in the global efforts and the unwavering support that is evident in today's representation. I applaud all efforts and look forward to overcoming this pandemic collectively. Thank you very much.
Brazil has a historic commitment to vaccination. The immunization program of Brazil is a milestone in the prevention and eradication of communicable diseases in Brazil. With 38,000 vaccination rooms, our immunization program has distributed since January 2021 more than 96 million doses of vaccines against COVID-19. Early in the pandemic, Brazil signed technology transfer agreements with international pharmaceutical companies to locally produce safe and effective vaccines against COVID-19. Today, our delivery schedules forecast more than 600 million doses by the end of 2021. Our goal has been to inoculate not only the entire Brazilian population, but also to go beyond our borders. The national production of the drug substance for the AstraZeneca vaccine, which will become a reality in the last quarter of this year, is an important milestone in our schedule. Brazil knows that in this pandemic, no one is safe until everyone is safe. Therefore, we joined initiatives that promote international solidarity for universal access to vaccines, such as the ACT Accelerator and its vaccine pillar, the COVAX facility. I would like to send the clear message that the COVAX facility can count on the support of Brazilian labs. With its accumulated experience and technical and productive capacity, Brazil will soon produce vaccines for COVID-19 and will also contribute to global immunization efforts. I thank the government of Japan and the COVAX facility for holding this event.
Pandemic has affected the lives of everyone on Earth. It made clear that we all depend on each other, and the most vulnerable are the ones most affected. International solidarity is critical to overcome our common challenge, and COVAX plays a fundamental role. A platform that began only 1 year ago has already sent over 77 million COVID-19 vaccines to 127 participants. It is a remarkable achievement and certainly the way forward. During the Portuguese presidency of the Council of the European Union, global health and international solidarity were top priorities. Team Europe is a major supplier of vaccines to the rest of the world and one of the lead contributors to the COVAX facility, with over $2.5 billion, about 35% of the current total. We will continue to lead these efforts with the European vaccine sharing mechanism directed to partner countries to complement and support COVAX. Portugal is also strongly committed, and that's why we are sharing 5% of our vaccine supplies with Portuguese-speaking countries. In addition, Portugal pledged the contribution of 10 million euros to the coronavirus global response, and we have already channeled 5 million euros to support prevention and the fight against the pandemic in partner countries. We have seen remarkable global efforts to fight the pandemic. Hopefully, the infrastructures put in place to deliver vaccines, the international cooperation which we bolstered, and the closer relationship developed between health systems in all continents will remain. They can be the foundation of a new international and better integrated health system in which the world will cooperate as one. We can start today by increasing the support for global vaccination. Thank you.
Danke. Shukran. Obrigado. Secretary Huracabat, Minister Labia, Minister Queiroga, and Minister Andre. We had 30 speakers in the pledging sessions. Thank you again for your generous support. We will conclude this second pledging session here. The total amount of the pledges will be announced in the closing session. Now, in this closing session, I will invite the co-hosts of this event and the representative of AMC economies. First, we will receive Prime Minister Suga to sum up the result of the summit, including the total amount of pledges, and President Lourenço of Angola as a representative of AMC economies. Prime Minister Suga, please.
Excellencies, distinguished guests, ladies and gentlemen, as a result of today's summit, we have secured much more than our target of $8.3 billion, thanks to your strong commitments and generous support. This means that we have achieved the goal of securing at least 1.8 billion doses for nearly 30% of the population of AMC eligible economies. This is an extremely significant and meaningful step forward in securing global equitable access to vaccines. I would like to express my sincere gratitude to each country and organization for their contributions as co-host of this summit. We also welcomed new donors, including from emerging countries and private companies. I am happy to see the circle of partners growing in the field of global health. However, in order to further advance equitable access to vaccines, challenges still lie ahead, including sustainable financial contribution and increasing production capacity. Comprehensive effort in therapeutics, diagnostics, and health systems strengthening through the Act A accelerators is also of critical importance. Going forward, I have high hopes that we will continue to see new commitments. Japan will also continue to do our utmost to contribute to ensuring equitable access to vaccines. In addition, as part of our efforts to achieve universal health coverage, Japan also places importance on the support for health security in a wide range of areas, including nutrition, water, and sanitation. We will host the Tokyo Nutrition for Growth Summit 2021 in December this year to improve nutrition across the world. It is our important responsibility to overcome the current pandemic crisis and prepare for future health crises, thereby leading the world to build back better. Japan is determined to continue to lead international efforts in the health arena with an emphasis on multilateralism, together with all of you. Thank you very much.
Angola está a responder à pandemia.
Angola is responding to the COVID-19 pandemic through vaccination in a context of economic difficulty, but with much engagement and dedication of health and educational staff and security forces who, in an effort coordinated by the government, are doing their utmost to guarantee the protection of the most vulnerable and exposed groups. We also see an excellent response from our population that has been going to the vaccination centers to strengthen the cold and supply chain. Angola has built a new central storehouse for vaccines and has also implemented a new digital platform for real-time vaccine and vaccination materials management that's already up and running in 6 provinces and will be expanded to the remaining provinces in order to support for the management of all types of COVID-19 vaccines and also routine vaccinations. To respond to the COVID-19 pandemic, our country has also launched an individual electronic registry for immunization. Angola has diversified the vaccine supply in order to enhance the protection for its population, and I thank COVAX for the 1.1 million doses of COVID-19 vaccines that we have received so far. And we hope that the doses of vaccines for our AMC 92 countries may increase to the number corresponding to 20% of our populations. We also thank COVAX for the essential support and extension of the cold chain to ensure adequate conservation of COVID-19 vaccine. To conclude, we would like to call on countries and private donors participating in the One World Protected Summit in order to provide all the necessary support for this initiative, because we believe that your collective solidarity action will contribute to overcome this huge challenge that our populations and states are faced with, given the threat to human life and the normal functioning of our social and economic structures caused by the COVID-19. Thank you very much.
Thank you, Prime Minister Suga and President Lorenzo. In closing, Professor Bazzolo, Chair of the Gavi Board, will deliver his remarks. Professor Bazzolo, the floor is all yours.
Thank you very much, Mr. Minister. Excellencies, ladies and gentlemen, as we close this great and successful summit, I thank you all for your participation, engagement, new pledges and contributions. Thanks to the tremendous generosity of everyone today and all of our commitment in ending this pandemic, I'm very pleased to announce that collectively we have secured close to $2.4 billion to date, which brings the total contribution nearly to $9.6 billion for the procurement of vaccines and $775 million for delivery. There were also new commitments of vaccine dose donations to COVAX of more than 54 million doses today. This brings the total doses confirmed for COVAX to more than 132 million doses. Thank you. I'm thrilled by what we all achieved here today. By coming together in solidarity, we have laid a path to end this pandemic. I'm immensely grateful to the government's philanthropy, the private sector. Your generous support will let COVAX deliver so that no single country is left behind. Like Prime Minister Suga of Japan, I congratulate everybody for making this summit a success. When we launched the One World Protected Journey 6 weeks ago, hosted by the United States, we had $2 billion gap to our at least $8.3 billion United States dollars asked. But here we are today. Global solidarity, collaboration, partnership, and being innovative is what we can now truly celebrate. Being innovative leads me to thank the European Commission and the EIB for the commitment of additional 300 million euros in support. This new financing facility will allow COVAX to rapidly acquire vaccines for sub-Saharan African countries under the cost-sharing scheme. Our efforts will also be boosted further by those donations from several governments, which will help accelerate equitable access through COVAX. And once again, I thank them for their generous contributions. Today's summit clearly demonstrates that global leadership understands and supports this. Today, these pledges and expressions of solidarity, we have taken a big step towards one world protected. Thank you all very much.
Thank you, Professor Barroso. We have come to the end of this COVAX AMC Summit. Thank you so much for joining us today, and to all the speakers for taking time out of their busy schedule, your busy schedule, as the battle against COVID-19 continues. However, based on the achievements we have made today, let us show the power of solidarity of the international community. Thank you very much.
Thank you for joining us today, and thank you for your continued interest in COVAX and in our Gavi COVAX AMC. Now, as you know, we try and schedule these briefings on a regular basis to give you the opportunity to catch up on the progress we're making. And today, of course, has been a historic milestone for the AMC, or for the Advanced Market Commitment, as it marks its first anniversary. I'm sure you'll have many questions. So I'm going to keep my remarks brief. We only have 30 minutes for this one. On the panel today, we have Seth Berkley, the Chief Executive Officer of Gavi, the Vaccine Alliance, Michael Froman, Vice Chair of MasterCard, representing the private sector, who of course came in great force and in great style today at the AMC Summit, and my dear colleague Marie-Ange Sarakayan, Managing Director, Head of Resource Mobilization, Private Sector Partnerships and Innovative Financing at Gavi. Now, I've asked our speakers just to keep their remarks brief so we can have as much time for questions as possible. But before I do, a couple of housekeeping rules that you won't be unfamiliar with. To protect the stability of the platform, we will keep you on mute. We will unmute you when it's your turn to ask a question. And of course, raise your hand when you want to ask a question. If you do want to not raise your hand, then you're equally welcome to put a question in the chat. We will try to get to those in equal measure. And of course, we want to make this session as valuable as possible for everyone. So we ask you to avoid country-specific questions. If you do have a country-specific question, we will take care of you. We'll get back to you as soon as we can, either myself or my colleagues in the Gavi media team. So with that, I'm going to pass over to the panel. We can get started. Seth, a historic day, a moment of great pride, but also a signal of the work that's got to be done still.
So thanks, Ali, and thank you, everybody, for joining us and your continued interest in COVAX. We've now concluded the AMC One World Protected Summit, and you've read the headline. I believe the press release has been passed around with you. Marie-Ange will give you some more details behind the fundraising, and I'll keep my remark also, as Ali said, brief to allow time for questions. The first thing I want to say is a huge thank you to our co-host, Prime Minister Suga, the people of Japan, and all of our donors, sovereigns, private sector foundations, and the public, for helping us not just meet, but exceed our target today. 1 year ago, almost to the day, it was June 4th, we launched the COVAX AMC market commitment. The AMC, as we call it, was based upon an innovative mechanism Gavi pioneered back in 2009 to fight another killer disease, pneumococcal pneumonia. Last June, we started with about $200 million that was mostly coming from that previous AMC, and we've set ourselves a target to raise an urgent $2 billion by the end of 2020 to start going ahead and purchasing doses, assuming that vaccines would work. Of course, we didn't know at that point whether any of the vaccines would work. So we met that target. We continue to build momentum in terms of resources and securing the doses we need to assure that there is vaccine access to every country on Earth. As you know, today we've delivered to 127 countries around 80 million doses, and we're proud of this accomplishment, which represents a stark contrast to the last pandemic in 2009, when rich countries secured almost the entire global supply of vaccines for swine flu. This time, we've gone twice as fast, to 4 times the number of countries and to 7 times the numbers of doses. So we're doing better. We heard here about the importance of it from the donors, the self-financing participants, the middle and low-income countries, and this is a critical public health response. But that being said, we also know we need to do much, much better. Our early secured supply has faced severe disruption as a result of the terrible second wave in India that is consuming all of that country's production, to the point where by the end of June, we'll be facing a shortfall of 190 million doses. This supply route will return, and our partner, the Serum Institute of India, has committed to prioritizing COVAX once again, once domestic needs are in a better place. In the meantime, new supplies will steadily come online, with Gavi signing new advanced purchase agreements with 3 manufacturers, Moderna, Novavax, and Johnson & Johnson, in May alone for another 1 billion doses. But we remain deeply concerned about the short-term disruptions we face. That is why, in addition to today's much-needed funding, which we will need to continue to put orders in for vaccines going forward, we need all countries that have doses to share a portion of them with COVAX now so that we can get them into the arms of those that are at most at risk of the virus and help prevent the emergence of more deadly mutants. Some countries have shown great leadership already, and we're already allocating doses from countries including France and New Zealand. We appreciate all of the announcements of dose sharing made today and urge all others to follow. Towards the latter part of this year, COVAX's supplies will ramp up considerably to the point where we predict countries' health systems will be running at close to their capacity in terms of the ability to deploy vaccines. Besides the need to stop the pandemic now, this is why it is so important that dose sharing happens now rather than later in the year. So today's a really vitally important day for COVAX. It means that we can continue with our ambitious goal to deliver 1.8 billion doses to the 92 countries and economies that are eligible for support from the AMC. We call it an AMC, an advanced market commitment, because it means exactly that. We have to use this cash now to lock in the supplies for later in the year and early 2022. Before I pass on to Michael, I'd just like to thank again Prime Minister Suga and the government of Japan. I know the Prime Minister and Foreign Minister Motegi would have liked to have been here with us had the time difference be a little less unfavorable. But thanks to their major donation and instrumental leadership in bringing together the global coalition ahead of the upcoming G7 summit, we're now a lot closer to our goal of having vaccines to be able to help end the acute phase of this pandemic. Michael, over to you.
Well, thanks very much, Seth, and congratulations on today's event. This pandemic has really created a remarkable collective humanitarian response by the public and the private sector. For our part, that's meant supporting testing across much of Africa. It's meant engaging with India and other countries that are going through crises and providing support. We're now getting involved in vaccine education and awareness in certain markets. And of course, our commitment to Gavi, the $25 million commitment to Gavi that has leveraged other matching grants as well. Why do we do this? We're not a healthcare company. We're not a pharmaceutical company, but it becomes obvious to us that we thrive when economies around the world thrive, and our business is healthier when people are healthier. And that's why we've been so committed to doing this. It goes beyond philanthropy. It also means bringing technology and expertise and products and services and people to the table to try and help out in this crisis. We've been working with Gavi actually for the last couple of years on digitizing vaccination records and creating greater access to health services. And when COVID hit, it created an opportunity for us to take a step back and figure out how could we partner with Gavi further to address this particular crisis with digital technology as well. It's been a great learning experience for us. We are delighted to play a very small role in this overall effort. And I just want to commend Gavi, to Seth, to Marianne, to their teams for their ability to partner and to bring in private sector expertise as appropriate to supplement the efforts of government donors as well. Every company has something to contribute. We encourage others to do what makes sense for them to do. And every international organization has the potential to follow in Gavi's footsteps in terms of developing these kinds of public-private partnerships that we're delighted to be part of. So thank you for having me.
Thank you, Michael. And Marianne, over to you briefly. You've been, living and breathing this process since the, if not before, the investment opportunity was published in April 15th. That's been a very, very rapid period in which to raise this vital funding. Tell us a little bit about the significance of today and about maybe your priorities going forward.
Thank you so much, Oli. And look, first, I really want to commend the government of Japan. This has been a tremendous lift. And actually, what today means is that actually governments around the world have heeded our cause and our call to get advanced funding to accelerate access to vaccine. And clearly, what we see now, over this 1 year period, we have seen an incredible increase in the number of donors. We now have close to 50 sovereign donors and 42 private sector partners joining the cause. And a lot of these donors have actually made tremendous support, like Japan quadrupling its contribution, big contribution, of course, from the European team, from the US, from a lot of countries. So it means that it works, and actually people are getting this. Of course, what's also important is being able to leverage these donor funds. And there, I think what's important today is having the contributions of partners like the European Investment Bank that actually have put forward a facility to help, obviously, countries' domestic resource mobilization so that they can get further doses through COVAX. So that's really great, 300 million euros. And we are also working with other multilateral development banks to actually leverage better domestic resources so that we can continue having further access to doses. The key here is that financial innovation needs to continue. We have been fortunate to use also our innovative finance instrument. The AMC is one of them, the vaccine bond also. But we do need to continue. And finally, private sector is really in Gavi's DNA. I'm so pleased to see partners like MasterCard and others coming to the table because, as Seth said, of course, there's the funding, there's reserving doses, building the capacity, but there's also the process of vaccinating. And there we need the expertise of the private sector. This will be critical, especially to run the largest immunization campaign ever. So I'll stop there.
Thank you very much. And a very, very good point you raised there about today has been about raising money for the doses to be procured under the advanced market commitment, but also raising the ability and creating an ability and opportunity for countries to go beyond that and procure further doses as well. Thanks very much. Now we'll turn to questions. So in time-honored fashion, please raise your hands and we'll try to get through as many as possible. Let's start with the first three. So if you could, we will unmute you. Jenny Lee Ravello will take, and then we'll take Carmen, and then John Zaracostas. And we may know you in the Gavi media team. My colleagues may not. So please let us know who you're writing for, who you're working with, please.
Hi, can you hear me?
You're very well, Jenny.
Yes, thank you very much. So Jenny Ravello from DevEx. I know today you've reached more than what the target in terms of funding, but in terms of the vaccine doses that were committed, I think it's more than 54 million doses. Are you disappointed that it's very little? I mean, it barely covers the shortfall you're about to do by the end of June. And you mentioned about the recent agreements with other vaccine manufacturers, but I understand not all of that will be available this year. So are you also eyeing to purchase vaccines, for instance, from Sinopharm and Sinovac, which received WHO emergency use listing recently? Thank you very much.
Thanks, Jenny. So there's two questions, one on dose sharing at today's summit, and the other one is around our supply and whether we'll be looking to augment with other agreements. Carmen, over to you.
Hi, thank you for giving me the question. Yeah, I wanted to understand a bit what happens with the people that need to get their second AstraZeneca dose soon, and there's no supply in the country for that. Are there any plans in place to respond to that through dose sharing? I would assume in the next few weeks, probably some people need to start getting their second dose. Is it the plan that they're just going to get a one-shot Johnson & Johnson later, and they will be fully immunized? What's happening there? And also, UNICEF announced last week a deal with Sputnik, or for Sputnik doses, and I wanted to understand a bit whether that's part of COVAX and how that works. Thank you.
Thanks, Carmen. So again, two questions here. What do we do about the second doses? I can say that we've publicly stated our priority in terms of deliveries and making up for the supply shortfalls is to make sure that we have a solution for those countries that received a first dose. And again, likewise on Sputnik, there was an LTA, a long-term agreement, as it's called in the trade, signed last week, but that, of course, does not mean that there's an agreement, any advanced purchase. Of course, I'll let my colleagues comment on that, but that's in case that's very helpful to you. John, we'll go to you next, and we'll pass back to the panel. John, we can't hear you. Okay, John, we'll get you back in later. We'll just go quickly to Agnes, and that will round up our first round of questions.
Yes, hi everybody. Thank you for taking my questions. You talked before of a press release, and we didn't get it. So I would be pleased if you could let us know what are the basic figures of the money raised at the summit. So that was the first question. And the other question is about the fact that you say that you are still deeply concerned by the short-term disruption COVAX is facing. So I wanted to know, what are you doing in terms of discussing with other laboratories, especially in particular Chinese laboratories that were approved by WHO? Are you in discussion with them, and what can you tell us about that? Thank you.
Thanks, Agnes. That's great. So, Mariusz, perhaps, and by way of explanation, that press release should be in your inbox right now, but it was quite a rush getting the numbers totted up after the end of the summit and working out some of the currency conversions. So it did take us a while. It should be in your inbox now. But Mariusz, perhaps we'll start with you, and maybe you could give some of the headline numbers from today's summit.
Sure. I mean, basically, as you know, we launched mid-April a call at our investment opportunity launch with Secretary of State Blinken to raise an additional 2 billion by today. And today, in fact, we raised 2.4 billion. As I was mentioning, a big part comes from Japan, obviously, as the host, because Japan quadrupled, and Japan now a contribution to the AMC is 1 billion. But of course, we had also very important contribution from Europe, Italy, Germany, Sweden, and all the European countries, Canada, and also a lot of new donors. Actually, we had today 8 sovereign donors. So in a sense, it gives you a sense of the importance of the pledges coming from G20 and other parts of the world to cover for the 2 billion. So basically, we ended up at 2.4 billion for the target of today. And if you look at the pledges that were made since last year, it brought us to 9.6 billion. So well above of what we needed. And so we are hoping that with that upfront funding, we will indeed be able to accelerate access to vaccine and indeed have some of the mitigating measures to make sure that countries can get doses as soon as possible.
Thanks, Mariusz. Seth, a couple of questions here that you'd be best placed to answer. The 54 million doses that were announced as dose shares at this summit. What is your reaction there? Of course, the summit today was about raising the cash and fully funding the AMC. I'll let you weigh in on that one. And also, all the questions really touched upon what measures Gavi is taking in terms of procuring vaccines for COVAX and with regards to other manufacturers and other routes of other sources of supply. Over to you, Seth.
So thanks for the question. So first of all, on the 54 million doses, we're happy to get those. Those complement previous announcements that have been made. And in fact, as I mentioned briefly, dose sharing has already started. The critical issue is going to be the timing and trying to get those as early as possible to fill in the gap that's there. In terms of the AZ second dose, there is guidance from WHO that early in rollout, one should get those doses out as widely as possible to try to get protection. Because even with one dose, you get some protection, but of course, with the second dose, you get better protection. And so our hope is that we will be able to come in and provide those second doses. We estimate about 20 million people have received one dose and not been covered by a second. Just to say that, by the way, the dose schedule is 8 to 12 weeks is the optimal time for a second dose. But if it's 16 weeks, the only thing you do is you reduce that time to get extra, that you're not as high a protection, but the efficacy of the vaccine actually probably even increases more if it extends a little bit out. So that's where we are on that. And Bill Gates made a call at the summit for suggesting that countries should be able to donate more than 8 billion doses of vaccine, given the surpluses that are known by the end of 2021. So I think this is really a start. We've been working on getting the delivery systems, legal issues, and everything else in place. In terms of the questions on the other vaccines, as always, we are looking at every vaccine that has a potential role to play. So obviously, we're looking at the safety and efficacy of the vaccines. We're looking at the cost of the vaccines, and we're looking at diversity of the portfolio. And so we're going to continue to do that. It is good news that Sinopharm and Sinovac have now received emergency use from WHO, and that means that they potentially could be procured, we will continue to look at them and see if we come to a deal. In terms of the Sputnik question, I think Ali answered that. This is about the long-term agreement, but it would require pre-qualification and would require an APA, neither of which are in place now. So I think that covers the questions that were asked.
Maybe if I can complement only on the dose share, the total of dose share so far through COVAX is 132 million. And this has been done in a very short period of time. And we do see a momentum really increasing, that will continue increasing. We have the G7 in 10 days, so 132 million. So I think it can make a big difference to some of the shortfall that Seth talked about. And it's important to say that the mechanism is operational because we already have several batches of doses that have gone to countries. And they do go very fast. We have put in place a system that really covers with the legal framework all the countries. So it goes very fast. We were able to do it, donation from France in 24 hours in Africa. And now with France, we have the 5 batches that actually went out today. New Zealand also in the Pacific Island was very fast. And we just signed with Sweden and it's going to go out very quickly. So to say that once having a mechanism that is operational is key, and I think that's what we have. So these doses are coming out and we do think that it's going to ramp up very increasingly.
Thanks, Marie-Ange. And in case you missed it, there was a press release that we put out here at Gavi earlier this week. I believe it was Monday night or even Tuesday morning, to mark the first deliveries from New Zealand as well. So as Marie-Ange says, once we get those agreements in place, we are moving really, really fast. We have the machinery to make deliveries happen very, very quickly.
Ali, do you want me to answer the question in the chat?
Oh, from Agnes. Yes, we were going to respond to that because it's around the 92, 91, 92. Go for it, Seth.
Yeah, just the only reason is that India, given its size, is a special case. It's part of the 92, but we agreed to provide 20% of our doses to India rather than trying to get to that target there so we could have some equity between the countries. So that's the difference between the 91 and 92.
Now we have 6 minutes left. We have 2 more hands. Do we want to have another hand go up before so we can do a round of 3, or should we leave it at these 2? Last chance to put your hand up. Okay, so I think maybe John. Let's go to John. Can we get you back, John? John, we can't hear you. Maybe you can type your question into the chat. We're having obviously the problem with the sound. We'll move to John Cohen.
Hi, thanks for taking my question. I'm John Cohen with Science. There's been some talk of bilateral agreements for donations undermining COVAX. Do you think that bilateral donations undermine COVAX? And what do you want from a government like the United States, which has more surplus than any country, to spell out for COVAX? There's been a commitment for 80 million doses through June to be donated, but I don't know the details of how many go to COVAX, what type of vaccines go to COVAX. Ideally, what are you looking for from countries that want to donate?
Seth, do you want to start with that one?
Sure. Hi, John. Nice to hear your voice. You know, the issue on bilateral deals, getting doses into countries and into arms is what matters. So, you know, that's a good thing. But if we want to get equitable access, then the problem is if countries are just picking their favorites, what that also means is there'll be countries that will not be favorites. And one of the challenges we have in our equitable distribution mechanism is that we're not taking into account bilateral, you know, donations. So one of the advantages of going through COVAX, it can be part of the equitable allocation, but also we can adjust doses, for example, for surrounding countries to try to keep this as equitable as possible. So that's why we're encouraging donations to go through COVAX. What we want, of course, are doses that are still with manufacturers, ideally, that have long shelf lives, and obviously vaccines that have pre-qualification. We will take on an exceptional basis ones that have a stringent regulatory authority if it's not pre-qualified yet. But the critical issue there is trying to go ahead and get doses that can be used without a complex regulatory mechanism as well. Speed is the critical issue here, and that's why we're trying to have a systematic process. The last thing I'd say is, of course, as you know, John, well, manufacturers have required indemnification and liability and no-fault compensation, and if it's donated through COVAX, that is included. And of course, we help the countries on their cold chain and delivery issues as well. Marianne did mention, in addition to the 9.6 billion that was so far set aside for COVAX, there's also 775 million in delivery costs also.
Thanks, Marianne. I wonder if you have anything to add from your conversations over the past weeks vis-a-vis dose sharing.
Well, I think really what we see countries are interested is really the fact that we have indeed a whole setup with countries that can allow them to first know which country needs the most vaccine, to the point to your earlier colleagues, because you want to direct it where it's needed the most, and then indeed where it goes the fastest. And that's what they value in COVAX and in our dose sharing mechanism. So we actually see that in discussion with them as they get to know better the COVAX mechanism, and they hear from their other colleagues, the other donors, you know, that are actually very complementary. France, New Zealand, and others, and Europe, they do actually are coming to us. And a lot of them that were, in a sense, thinking about bilateral now do come to us because they do value this, the legal agreement, the no-fault compensation, and the fact that the doses will go fast where it's needed the most.
Thanks, Marianne. John Zarakostas, we got your question in the chat. Thanks for that, and sorry about the sound. The question is directed to Mr. Freeman, but of course, Mr. Freeman is not a vaccine manufacturer, so I don't think it's probably something that he would like to weigh in. He's, of course, welcome to. But instead, Seth, maybe I could ask you just to provide a line or two on this one. The question is how important it is to get an IP waiver for COVID-19 vaccines before the WTO in December. Obviously, a very, very hot topic at the moment.
Yeah, the critical issue is that we end up with as many manufacturers producing as is possible. And so to do that, IP may play a role, although that's not tends to be the restriction for vaccines. The critical issue is know-how. And so what we need to make sure is that there is a partnership between companies to do those technology transfers. And so, you know, for us, the critical issue is what incentives can we put in place to have those tech transfers? So far, tech transfers have been an important part of what's going on. I mean, not just the ones in developing countries we talk about, but ones in South Korea, ones going to Japan, there's one going to Europe, to Brazil, to Indonesia, many countries around the world. So I think what we really want to see is a world where that's incentivized. Right now, the real limit has been the expertise, because of course it's quite complicated to do that technology transfers, and given the many that are going on, teams are overwhelmed, and it's been hard to get that type of expertise easily replaced. People have come out of retirement to help on that.
Thank you, Seth. And of course, really heartwarming and encouraging hearing Paul Stopples from Johnson & Johnson talking about the efforts that his company is putting into Aspen in South Africa and elsewhere. We are at the bottom of the hour. So thank you all for your questions. Thank you to my panelists for joining us. It's been an intense few days, and I'm glad you're able to find us time to join us this afternoon to wrap this event up. All I can say on behalf of the Gavi communications team is that you know where we are. We have the pleasure of talking to you and communicating with you on a regular basis. We're not stopping here. We've got a lot of work to do, but stay in touch.
That I was talking about.
Thanks so much. This session is now over.
Thank you.
Bye-bye.
I told you, it's for that I was saying it's not about the masters.